It's a great honor for the Harvard Medical School Center for Global Health Delivery to co-host this important set of meetings where you will be examining the effects of pollution on health. I want to begin by thanking our co-hosts, the Harvard Global Health Institute, the Middle East Initiative at the Belfer Center at the John F. Kennedy School of Government, and our distinguished colleagues, Professor Petros Koutrakis in the Department of Environmental Sciences at the Harvard Chan School of Public Health, and Professor Eric Garshik from the Harvard Medical School and the Veteran Affairs Hospital in Boston for putting this meeting together. Before we dive into the topic at hand, I just wanted to say a few words. The mission of Harvard Medical School is to nurture a diverse and inclusive community dedicated to alleviating suffering and improving health and well-being for all through excellence in teaching and learning, discovery and scholarship, and service and leadership. And at the Harvard Medical School Center for Global Health Delivery, we contribute to this mission through a focus on the last phase of care delivery, figuring out how the fruits of modern medicine can reach people in communities where they live and work. And for many years now, our center, which as some of you know, has had a hub in Dubai, has been trying to understand better how and why rates of diabetes, heart disease, asthma, and other inflammatory conditions have been rising around the world. And of course, there's many theories, the food additives, processed foods, so exposure to foods themselves, exposure to plastics and other environmental factors. And it's in trying to understand these environmental factors that we really are pleased that we've linked up with all of you, because we think that there's much knowledge that you can share with policymakers. Understanding how environmental factors, in particular pollution, especially the effects of 2.5 nanometer particles, the effects on health, we believe is a critical part of understanding a key driver of disease and should be informing public policy. So this is very important as we see an epidemic of diabetes with an estimated more than 600 million plus people expected to have the disease in the upcoming years. So at the start of your meeting, I want to compliment you for taking on this very important topic. I know many of you have been working on it for years. Your task today is to lay the foundation for better thinking around health policy and help us all think about the intersectoral linkages that will be needed in order to address some of the diseases we're facing today. We've spent years treating patients, making sure that they take pills, making sure that they adhere to treatment. And while that's important, this other factor of understanding what the drivers are and how we can actually ameliorate it on that level is extremely important. So on behalf of the HMS Center for Global Health Delivery and our co-sponsors, I want to tell you that we're honored to be part of your work, and I wish you a very good meeting. Thank you.
Thanks, Salman, for this great invitation to organize this virtual meeting. Originally, we were supposed to be in Dubai all together in a wonderful place and meet and get to know each other and make connections and think about the regional problems. Unfortunately, this pandemic really has a great effect on the global health, including our activities. We were supposed to meet last April and we postponed the meeting, and now we end up doing this virtually. Hopefully this meeting will enable us to get to know each other and maybe organize similar activities in the future. I think I would like to thank my colleague Eric Garshik for helping out to put together this conference. And also I would like to thank Susana Aquileos, Dr. Susana Aquileos, who is going to chair today 2 sessions. And Susana she's currently a researcher in the Cyprus University of Technology. She's a chemist. She got her bachelor's of chemistry from Athens, and then she got her master's from the Cyprus Institute of Public Health. And eventually she came to Harvard, where she did her PhD and postdoc with me. So she's an expert in exposure assessment and health effects, and I'm pleased she has agreed to chair this session. before I pass the floor to Susanna, I would like to, I have few slides as a, just to motivate the discussion and share some of my experience. I need to share the screen. Um, can you see my screen?
Yes.
Good. So in about it, after the Iraqi aggression in the early 2000s, we Harvard School of Public Health, we went to Kuwait, where we tried to study the environmental impacts of the Iraqi aggression. And one of the things we did, we studied air pollution. And when we did the 2-year study, and where we measure exposure to particles and other pollutants. And what we found is that the levels were excessively high. You can see here the concentrations in Kuwait were for PM10, 110 micrograms per cubic meter, and for PM2.5, 4.5, while the US standard is 50, back then was 15, and now it's 12 micrograms per cubic meter. So this was an early indication that air pollution might be a serious problem, not just only for Kuwait, but for the region. And in 2008, I had the great honor and opportunity to organize a regional meeting on air quality and health that was sponsored by the ECAT, which is Environmental Center of Arab Towns, situated in Dubai, and where we brought different people from around the world to share our experience and discuss the issues. And as part of that activity, I read several reports, and also I learned a lot about the area. And I realized that maybe other people knew already, but at that time I became aware that there is a excessive urbanization in the MENA area, which is the Middle East, North Africa area. And here you can see the West Asia, the growth of the urban population, which is dramatic. And of course, this has created many cities with serious environmental problems and pollution problems. And my friends from Kuwait and from the WHO and from other areas are aware about these issues. There are cities with excessive air pollution, the cars which are not well equipped with air cleaning devices, industries which are very close to the populations, inappropriate disposal of solid and hazardous waste, and of course, excessive burning of oil and oil refinery activities. In addition to that, the area experiences serious dust storms, and as you know, over 1 to 3 billion tons of dust from the different deserts around the world is moving every year from place to place, and the MENA area is heavily impacted, not just by the Sahara dust, but also by the Arabic Peninsula desert, the Southwest Iran desert, even the Gobi desert. So there is an excess of exposure to dust particles. Originally, many years ago, we thought that they were not toxic because they are natural. But as you will see today and tomorrow, particles from the desert, they carry microbes, other metals that can really pose a risk to health. We can use these days satellite technologies to assess exposures to dust and other pollution. And as you realize, there is very little monitoring in this area. And you will see one presentation today where we can use alternative ways to assess exposures in order to understand human health effects to air pollution. In addition, this area is a receptor of pollution coming from Western and Eastern Europe, also from Asia, Central and East Asia. We all know that it's an area with high temperatures, and that will really be affected greatly by climate change. And the climate change, we have a presentation about this. It will really impact this area in many ways. For instance, climate can make the desert drier and increase dust emissions, as I'll show you. Climate change can affect the photochemical activity of the atmosphere, enhance chemical reactions, more formation of ozone. It can affect directly human health, and also can affect indoor air quality that can ultimately affect health. So we have Dr. Barak Al-Ahmad will discuss about the impacts of climatic changes in this region. So we have here is a list which is not exhaustive, that different participants from the United States, from the region, from Europe, from Israel, from Cyprus, and I think we have many more, but I just enumerated some of these. We have over 100, even more participants that we will share the names, and also we will have proceedings of this conference that you can access later on. And again, please, this is just one of the first steps. Try to get together and work together. And I hope this is an opportunity for us to stay in touch during and after this conference to discuss issues and help the way, in any way we can. So before Susanna, here I'm starting my presentation. I don't know if you want to say something or if I continue and then you take over.
Yes, just a few logistics before you continue, if I may. First, I would like to welcome everyone. Good afternoon, good morning, wherever you are. It's an honor to be here today, and thank you for the invitation to be part of this Nexus of Climate Health webinar. So before we continue, I just wanna say that you can pose your questions in the Q&A chat. We'll try to address a couple of these questions, more clarification at the end of each presentation, but we'll have a 15 minutes discussion every 3 presentations to address most of the questions that you're posting. Thank you. So Petros, I guess the floor is back to you. Okay. And we can officially start with the rest of the presentation. Thank you.
Thank you very much. Here I'm going to present a few studies, recent publications we have, which were the studies done in Kuwait and in the region surrounding Kuwait, but they really apply to many more areas. So we can really use these findings as a base to make decisions about the future, about research or about policies or technology transfer, whatever. So following that original study in 2004, we did another air pollution study in Kuwait. And this time, our funding came from the Veterans Administration from United States, supported a monitoring network of 2 sites. And as you will see later on, the United States Veterans Administration is concerned about the exposures for the deployed soldiers during the Iraq War. And as a result, we have developed exposure models. We have done different measurements, trying to retrospectively go back and assess exposures. And as part of that activity, we had funding from VA. We also had funding from NASA that is trying to establish satellites in different areas around the world. And we convinced them that one of these areas should be the Middle East. They are going to have these measurements of air pollution continuously on stationary satellites, and hopefully people from the area, hopefully many of you would be interested in using these exposures for health studies. So also we are working with the Kuwait Institute of Scientific Research, KISAR, and the Kuwait EPA. So there is kind of a synergy here where we have done different studies funded from different sources, but of course, everybody can benefit from these sources and studies. So I will present results here from two sites. We studied over a period of 2 years in Kuwait City, and south of Kuwait City, there is this Ali Sabah Al Salem ACES. And here are the two locations where we measured the Kuwait site and the southern site. And the southern site is a little bit closer to industrial activities. One of the major challenges in the area is to measure particles. It's extremely hard, as you know, but also because of the excessive dust levels, the particle samplers, they do not work, and they overestimate exposures because of the bounce off and the saturation of the samplers. And we developed a special sampler that can really withstand the high levels of pollution. And here is two collocated samplers from the Kuwait City, and you can see we really have addressed this major issue. I don't want to become too technical because we don't have time, but make sure that for those who do monitoring there that they use the right equipment to measure particles. We were not surprised to see that for most of the days, the WHO and the USA National Ambient Air Quality Standards were exceeded in both sites for PM10 and PM2.5. The KIPA, which is a Kuwait EPA standard, is very high. It's not really appropriate to protect human health, and was only exceeded 6% or 8% or 2%. But the bottom line here is the concentrations are high in Kuwait City, and frequently exceeding the international air quality standards. We did a source apportionment, which I think it's important, not just for Kuwait, but also for the area, because what we found is that in Kuwait City, for instance, 43+% is regional pollution, which comes from countries around around Kuwait, and some from Kuwait, but it's basically a regional impact. 20% comes from dust storms, and then only 18% comes from local traffic and road dust. So, and you get the same conclusions here. This is really important because we have small countries, some of them in the Middle East, where their pollution impacts other countries, but the exposures are associated with sources from other countries. So basically, it's really hard to reduce pollution exposures if you just try to develop policies that they are national. And I hope our friends in Mazim and others at the regional WHO convince the different governments to work together to try to address air pollution problems there, because each country will not be able to do this individually. And to confirm this observation that the pollution is kind of regional, you can see here the levels for mass, PM mass, sulfur, black carbon, the soil elements that come from the dust, and these industrial elements, that the levels are very similar in the northern and the southern Kuwait sites, which indicates that, you know, this is mostly regional pollution that needs to be addressed by not only the Kuwait industry, but other industries in the region. So we also published a paper where we try to understand what really happens in the indoor environments during big dust storms. And we measure particles inside and outside 10 homes in Kuwait. This study was supported by the Belfer Center at the Harvard Kennedy School, which is supported by KFAS, the Kuwait Science Foundation. And these are the measurements inside, outside, and inside. And what we really found, which was not surprising, but interesting, is that the levels of pollution inside homes are lower during the dust storms. And actually here, you can see the indoor-outdoor ratio of PM 2.5 during the non-dust events and during the dust events. So when we have large dust events, the people close their homes very well. And as a result, the indoor-outdoor ratios of pollution, particulate pollution, during the dust storms is only 20 to 30%, whereas during the non-dust storms, we have the typical 40 to 60% penetration. So in terms of the policy, these results are really important that we can forecast dust storms, inform the public, and ask them to close their homes and stay inside to protect themselves. Now, this Kuwait is a developed country, but maybe there are other countries in the area where they don't have air conditioning, where the homes are not as well built as the ones in Kuwait. Also, there are people in the desert that they can be exposed to excessive high levels of particulate pollution. So it's encouraging to see these results, but it does not mean that, you know, other populations in the area will be protected as well. And I will last present a third paper we published where we try to understand the levels of dust in the region and understand especially what kind of meteorological factors enhance these dust levels. So my associate, Dr. Jin Lee, who is going to present another paper later on, did a nice study where she took this region that includes Iraq, Saudi Arabia, Iran, Syria, and of course Kuwait here. And we tried to link the dust levels that we got from the NASA MIRA code. These are the reanalysis data. The resolution is about 50 by 50 kilometers, more or less. So it's pretty good. And one of the data parameters we used is NDVI, which is a normalized defense vegetation index. And this shows the greenness of the desert. You know, people probably like me in Europe or in the United States were not familiar with the desert. We think that it's a dead surface, you know, sandy, and nothing happens. But for what I learned from my short experience is that the desert is an organism There is greenness during the winter. There is a lot of activity. There is tightness that holds the sun down. And NDVI is an important characteristic that we can really study and understand how it affects levels of dust in the region. And this NDVI is measured monthly, 1 by 1 kilometer resolution. Then we got meteorology throughout the region, wind speed, relative humidity, temperature, precipitation, and also we had dust storm days from the Kuwait Meteorological Station. The time resolution was monthly, and the period we studied was between 2001 and 2017. And the first thing we wanted to do was to see the dust in different countries, and these are like milligrams of particles per cubic meter near the surface. And you can see the highest dust levels were in Kuwait, and then we had Iraq and Saudi. And here we show the trend. This is the annual trend of the dust levels. And overall in the region, we have an increase of dust levels during this 16-year period. Although in Iraq and in Syria, we had a decrease actually of the levels. I'll tell you why in a second. So here is the general area. The first thing you can see that the dust levels follow this corridor, start from the South Iraq. Kuwait is the epicenter of the dust, and then they go down the southwest Saudi Arabia. And so I'll explain more why this is happening. But here are the trends. This shows that in Iraq, for instance, the dust levels decreased over the last 17 years. And this basically happened because the early years, the early 2000s, we had this major destruction, the war, military activities, destabilization, stopping of irrigation and agriculture. And then after the war ended, there was some slow recovery. And you can see this by just, that the dust levels start to decrease. Actually, we also see the NTVI start increasing because after the military invasion, all the stuff, the deserts start to stabilize. But we see here, some areas where the southwest Iran, some Kuwait, and across the coast here, we have increases of the dust levels. I don't have time to go through everything, but one of the points I want to make is that this shows the trend in temperature in these countries expressed in Celsius per year. And you can see here that all these countries experience an increase in temperature because of the climate change, and also these actually increases are higher than the global average. If you take 20 years, you will probably see about almost between 0.3 and 0.5 centigrade increase over the last 20 years, which is quite excessive. You see winds, for instance, in Kuwait have increased, and the NDVI in Syria has increased, probably the war, the last years of the war. The Kuwait also has decreased, and Saudi has not gone up. Iran and Iraq has increased, and as I said, probably the Iraq increase is due to the end of the war at the later part of the 2000 and until recently. The important message from here that we want to draw is that the levels of dust are strongly anti-correlated with the NDVI. So the years that the desert is dry and brown, those are the years that we have more dust. So if temperatures increase, if precipitation decreases, if we have human activities like wars or going for vacation in the desert, everything that destabilizes the desert surface and reduces the greenness has a direct impact on the desert levels or the dust levels. So we found a positive association between wind speed and surface dust in Kuwait, and which indicates that much of the dust in Kuwait comes from closed deserts, which means that any kind of activities that they destabilize the desert will really have an impact on the dust levels. We saw a positive association with the wind association between the dust levels in Kuwait and the winds in the countries surrounding, okay? And we saw that the winds have increased in the region in the last 20 years. And we saw, as I said, a negative association between the NDVI and levels of dust in the region. So I think it's clear that climate change and human activities, they have an impact on the desert, and these impacts really translate into higher levels of dust in the region. So I have other things to talk and ideas, but let's talk over the discussion, and this will conclude my presentation. Thank you.
Thank you, Pedro. I think we can discuss this more later, but I just have one, let's say, question, because I've never been to Kuwait. I would like to ask, what are overall the characteristics of the houses there? Because you say that when they close the doors during the dust storms, the penetration drops a lot. So I was wondering on overall, because here I know that some of them are old, other are new, so it varies, but I don't know if you can give us a little bit information about that.
Yes, we have people from Kuwait that they can, they know better, but I will answer because I'm familiar with Greek and Cyprus homes, and the homes they are very tight, very well built. The doors are sealed very well. They don't have these openings that we have, if you go to my country. And also they use an excessive amount of air conditioning. The problem with that actually is, okay, the dust goes down, but the air conditioning, always there is deposit of dust in the ducts. There is very little cleaning. And in areas like Dubai, like UAE or Kuwait, where there is humidity, UAE has more humidity. Actually, there is a growth of mold when these dust particles settle on the ducts, and I think there are respiratory problems associated with those. So yes, the homes are well sealed during the dust, but by doing that and using excessive air conditioning, you might create other problems that we need to measure.
Okay, thank you. And we can discuss this more later on. So thank you, Professor Koutrakis. And I think now we can move on to the next presentation. So let's welcome Dr. Ali Al-Hamoud. Dr. Al-Hamoud is a research scientist at the Environmental Life Sciences Research Center at the Kuwaiti Institute for Scientific Research. Dr. Ali does research in environmental and occupational health and safety, risk assessment, and natural and anthropogenic hazards. He's going to present us today the air quality situation in Kuwait.
Yes, hi, good morning. Hi, good morning. It's my pleasure to be with you today. I will talk about one presentation. I will show my slide now. Yes, okay. So I will start the presentation now. Good morning again. Basically, the presentation deals with dust storms over the Arabian Peninsula, the large Arabian Peninsula. We will look into the sources as well as the transport pathways. Then I will talk about the site visit, which we have visited basically the area which affect Kuwait. Then I will talk about the health impact related to dust storms, particularly PM 2.5 and PM 10, and then areas for improvements, rehabilitation. So really this is, I can say, a macroscopic, a complete picture. There are some, I will try to go very quickly because there are lots of slides. The contents, basically I will look, the first section will be the dust storms over the whole Arabian Peninsula at large from 2010 and 2018. Then I will go specifically into Kuwait. What are the dust sources affecting Kuwait from 2007 to 2018? After that, I will go into diurnal variations of dust storms. In other words, the day of the dust storm, and then 2 days before and 2 days after. Then I will talk about the health studies, PM 2.5 and PM 10, using WHO AirQ Plus model. And lastly, I will give some success story of mitigation of dust source areas in Kuwait. Now, the methodologies I used, we have looked into high resolution MODIS, Aqua, and Terra satellites, as well as NOAA's backward trajectories. And when we visit Iraq during the 1 week visit, we have took soil sampling from hotspot area, and you will see it, WHO AirQ model. Now, the first section, we will look into some of the source areas. As you notice here, this is really one very hot spot affecting Kuwait, as Dr. Petros also mentioned. This area here, as you can see the trajectories, the dust storm go from this area, which is, there are two areas basically. One is in west of Iraq, and then in southern Iraq, and it takes an eastern direction and goes into Kuwait and Iran. And another trajectory goes into a curve and covers Bahrain, Qatar, parts of United Arab Emirates, and goes all the way more than 2,500 kilometers to the empty quarter, which is one of the largest sources of dust in the world. And if you notice here, the brown colors, this is the mountains. And by the way, this severe dust storm, which originated from Iraq itself, but then while it was going through, it carried more dust from other areas, other source areas in Saudi Arabia, for example, Al-Dahana Desert. And then all the way, it went all the way there. And you see here, it stopped by the Najran mountain. And by the way, if these high mountains are not there, it will go to the Red Sea. This is another, in 2012, as you see here, there is one source of dust storm that from Iraq to Iran, major source, which we have visited in Iraq, and it covers completely, this white plume covered completely Kuwait, and it reached, this dust plume, actually it reached to the eastern Saudi Arabia. And by the way, eastern Saudi Arabia is the oil industrial sector. And again, it carried more dust along the way, and it emptied into the empty quarter from this source all the way to empty quarter. And also, by the way, here there is another source which is in Qatar, goes to the empty quarter, and also another one, eastern Saudi Arabia, into empty quarter. And by the way, you can see here some of the dust sources from United Arab Emirates. This is the third image. Also, this is different in a way that it started from the empty quarter of Saudi Arabia. It took in a clockwise direction, and it dumped into the Arabian Sea. And also it took a curved shape. It covered Saudi Arabia, the oil industrial sector, and Emirates, Dubai, Ras Al Khaimah, and also Oman. This is another dust source which came from Iran and also Iraq, and it took a different shape, counterclockwise, and it covered Bahrain, Qatar, all areas of United Arab Emirates, Dubai, Abu Dhabi, Sharjah, and so on, and also part of Iran. And it's interesting that started from one source and it covered all other countries. Now, this image is interesting that really the dust sources covering Arabia does not only start from Arabia itself, but here, this image from Afghanistan, Pakistan, Iran border. So other continents, still Asia, but Afghanistan border, also it went all the way, huge dust plume, and then it went into Oman. The last image, interestingly, from the Indian subcontinent, from Pakistan and Indian border. This is a major source. And it went into the Arabian Sea and it reached also Oman. And here you can see from certain areas from Iran. Now, the second topic, I'll talk about the dust storm source, which is in Iraq, which affects Kuwait. This is a very hot spot area that we have visited. And you can see here, this is like, if you can imagine a waterfall, but here this is sand jet that comes from one source and goes all the way to Kuwait. And here we have many different monitoring stations, and we notice that here, for example, this area has low visibility and high wind speed. And here also low visibility and high wind speed because of the color. But here, this area, as you notice, there is another also dust storm affected this area coming from the left. Now, when we zoom into it from this, here, this is the dust storm day. And by the way, the red color means dust storm event. So there were 2 previous days where there was a dust storm. And also on the day of the image, there was a dust storm. Interestingly, the dust storm starts mostly before noon, and highest peak is at noon. In both previous 2 days, high dust storm event at noon. And here, this is the low visibility. Also noon time, low visibility. And the 2 days after the dust storm, we notice visibility improved, but then around noontime, it dropped again. The next day, visibility improved, and again, it dropped down. So these 2 days following the dust storm, we call it suspended dust, which has fine particulate matter. So dust storm event does not only affect only 1 day, but also 2 days later. There's another dust storm which affects Kuwait coming from the same spot, also into Kuwait. This is Kuwait here, it covers all the way here. Another dust storm from Iraq affecting Iran. And by the way, if you look at this area here, it's brown. Why it's brown color? Because this is agricultural land, which is based between the Euphrates and Dijla in Iraq. And this was basically abandoned farms from the war. So here, luckily, yes, it does not affect Kuwait, but it carries organic carbons and many different materials. Again, when we look into Kuwait here, the highest dust storm event was at noontime. This dust storm day started between 7 a.m. and went up to 5 p.m. because dust storms is not only 1 hour or 2 hours, it depends on the wind speed. So here, this lasted for about 7 hours, from 10 to around 5 p.m. And the next 2 days also, there were less dust storms after 2 days, but they were more, but these 2 dust storms were local. This one was from Iraq. Third image, again from the source, and you see here this white plume. This, by the way, this plume went all the way from the source of southern Iraq, went into the urban areas of Kuwait, went into Bahrain, and reached as far as Qatar, more than 1,200 kilometers. And you see this one here, the brown color, from another hotspot area in Iraq, but it goes to the sea. It does not affect Kuwait. This is from Sentinel satellite, and you see this like powder, very close, high resolution of the extreme dust event sources from this area. And this is, by the way, this is the river. It's close to the river, but still it's a hotspot. This is the area here. It's about 250 kilometers from Kuwait. Now we visit the area. This is the third topic I will talk about. We visit the area. As you notice here, there is sand dunes, and also there is sand sheets. And that's me. And on the road says sandstorms and sand dunes zone. Be careful, caution. And this is, by the way, this is the major road which goes from Iraq into Kuwait. and mostly in June and July, huge sand encroachment on it. We took samples from the different areas. This is one of the this is the hotspot area that we visit, and also this one. Now this area is shown here. We took samples from different areas, 1, 2, 3, 4, 5, 6, and also from underneath. Interestingly, the fine particles, which are below 3 micrometers, after we analyzed them at Kisar, we noticed that mostly the fine particles were in the middle of the area, and also on the sides, middle and the sides. This area here at the bottom, although it is long, this does not reach Kuwait. Why? Because it has coarse particles, very large fractions that it's very heavy. It does not go as far and reach Kuwait. From this area here, which has fine particles, goes all the way to Kuwait and also stays 2 days suspended in the air after the dust storm day. This paper was published in the Science of Total Environment, and also the trajectory was published in Atmospheric Research. The third topic I will talk about quickly, these are the corridors, the wind corridors in the pink color. 3 wind corridors. Luckily, Kuwait is based here only in this urban area, close to the sea. This is the urban area. So really the high wind, the dust storm does not go through this region because this is not a wind corridor. It goes into here high. After we analyzed the sources, we found here very high fractions also in the wind corridors and this wind corridor. And luckily it is not in the wind corridor of the urban area, or really it would be a major disaster to the population. Now I will talk quickly about the impact, the dust storm impact. These are the oil wells. As you know, Kuwait is the major economic infrastructure is about oil wells. As you see, this is 2008 in one of the oil fields. These are the oil pipes covered by sand encroachment. This one in 2018, not too long ago, this is an oil pipe which is completely covered by sand encroachment. This is a person in 2008, he's clearing these oil pipes, as you see. Huge effect on the oil industry, as well as also on the roads, on the accident. Here, by the way, this is a traffic car that's going to save an accident which happened, but got stuck in this major road. This is by the way, a road, but with during June 2015, got stuck. Many accidents, loss of impact, economic impact and risk assessment of sandstorms also was published in sustainability. The health impact. Now we have used, this is the fourth topic, we have used the WHO Air Quality Plus model to estimate the burden of disease and the disability adjusted life years for PM2.5, PM10, ozone, and NO2. And we have looked at all cause mortality, long-term exposure, short-term exposure, as well as specific cause mortality, ischemic heart disease, stroke, lung cancer, COPD, ALRI, as well as hospital admissions, respiratory and CVD. Now the conclusion, basically, in terms of PM2.5, the high number of excess cases and attributable proportions of premature mortalities are related to ischemic heart disease and stroke. Respiratory diseases show high excess number of cases than cardiovascular diseases, respiratory diseases, effect of PM2.5. Expected life remaining, here what says that adults at 30 years old and 65-year-old, they can gain about 2.5 years and 1.93 years if we reduce the PM2.5 exposure to 35. Newborns also, they can, life expectancy can increase by 2.65 years if we reduce the PM10 to 70. This was published, environmental research, PM2.5, and PM2.5 and PM10 was published as well. Now the last section I will talk about how we can rehabilitate and mitigate. Basically what we have invented is we have, for example,
as well, okay.
So here, this is the source area. For example, we want to protect this area. We put fences here, 2 fences and trees in between. This is the fence. And you notice, basically, the sand encroachment around the fence get stacked here. And before and after the fence, very clear area. We have used native plants. Here I will show some images, then I will conclude. We have used later implanted one area in Kuwait, native plants with some irrigations. This is a success story, basically. We used also palm trees, branches. As you notice here, the dust also gets stuck between the palm trees. These are the palm trees surrounding this native plant. And the success story, after 2 years, native wild animals came back. They may look scary, but these are native wild animals that came back to life, as well as real native plants which were not available for the past few years. And this is our general manager of Kisar. We have made a celebration. We've invited the students, and this is the area that we have protected in Kuwait. We taught students to plant the trees and preserve the environment from public and private schools, many success stories. And this is my last slide. And thank you for listening.
Thank you. And we can get questions after the next presentation. So can you please stop sharing your screen? So from Kuwait, we are shifting now to Cyprus, where I have the opportunity and to present you some data about Cyprus. Cyprus is an island in the Eastern Mediterranean region, very close to Turkey, North Africa, and the Middle East. Cyprus has a typical Mediterranean climate of hot and dry summers and mild winters. It has been an EU member since 2004, and therefore the air pollution concentrations should obey target values posed by the EU regulations. For this reason, the Cyprus government established an air monitoring network across the island following the European standard. The air quality section of the Ministry of Labour, Welfare and Social Insurance is the authority responsible for the assessment, the monitoring and the reporting of air quality in the island. The first monitoring station was set up in early 90s, and since 2006, the network consists of 9 stations that are continuously monitoring levels of gaseous pollutants and particulate matter. In this picture, we can see the location of these stations, and as you can see, the network consists of 5 traffic stations located in each of the 5 cities of Cyprus, 2 industrial, 1 residential, and 1 rural background station. It was to mention here that the background station is part of the network, which is a program for monitoring and evaluation of the long-range transmission of air pollutants in Europe. PM is one of the most problematic pollutants in Europe. Over the years, PM in Europe decreased to meet the standards. However, levels in the Eastern Mediterranean countries continue to be high and exceed the regional standards. This map shows the PM10 annual level in 2018. The countries with green and dark green dots represent the countries with PM10 annual concentrations below the WHO annual limit of 20 micrograms per cubic meter, where the countries with the red and dark red shows the countries that they exceeded the annual European limit, and these include Poland, Italy, Slovakia, the Balkan region, Turkey, and Cyprus. So there's an increase in PM10 trend from the northwest to the southeast. Now, the main reason that the Eastern Mediterranean countries are more affected is because they are highly influenced by traffic volume, They have a significant PM background, a lot from the suspended dust and sea salt, and from the transported pollution from industrialized European countries, but also from dust storms that originated from the Sahara and the Arabian Peninsula. From a previous sampling campaign we conducted in Cyprus, we identified that regional sulfur and traffic emissions and biomass burning are the most significant contributors to PM 2.5. And especially regional sulfur is almost half of that. And for coarse particles, resuspended dust, sea salt, and raw dust were the major contributors. However, dust storms are the main cause of elevated daily PM10 average in the island. Here you can see the daily PM10 at an urban and rural station in Cyprus from 2000 to 2017. Blue lines represent dust days and black lines, the non-dust days. As we can see here that the PM10 levels are usually around the 50 micrograms per cubic meter, but they can rise to around 100 to 200 micrograms per cubic meter during a dust storm. But of course that can go much higher and exceed the 1,000 micrograms per cubic meter. The greatest influence for dust storm in Cyprus comes from the Sahara Desert, and this dust event here that I have in 2006 is an example of this impact of Sahara Desert. So we can see here it was one of the highest intensity event over these 18 years of time series. The island is also affected by the Syrian and Arabian desert in the Middle East. The dust episode in September of 2015 that some of us may remember is one of the most recent and intense episodes that Cyprus experienced. The episode lasted for at least 6 days. It started in September 6 and reached a peak of particle load on September 8th. On that day, as you can see the pictures below, the horizontal visibility was around 500 meters, and that also caused one of the airports in Cyprus to close. Now, back to the air quality section of the government. The section monitors weather models and satellite data for upcoming dust storms. And then it issues a dust announcement to the public when two of these three criteria are met, which are based on ground measurements of PM10. Criteria number 1 is for the PM10 levels to reach 100 micrograms per cubic meter in at least one of the stations. Criteria number 2 is for PM10 levels to reach moderate levels of 50 to 100 micrograms per cubic meter in at least 3 stations. And criteria number 3 is for PM10 background levels to exceed the 50 micrograms per cubic meter. It was to note here that the department is kindly collaborating with the Live Media Research Group in an effort to provide early warning to the public and also provide evidence-based protection measures to the public. Now, the daily PM10 levels in Cyprus exceed the European limit quite often within the year, and up to 5 times more than the permitted exceedances of 35 days per year. It was more problematic before the 2010, where almost 1 year we had almost 200 days within the year exceeding this daily limit of 50 micrograms per cubic meter. Now, the Air Quality Authority performs chemical analysis of filters they collect on a continuous basis, and in order to determine the contribution of natural sources such as desert dust to the overall PM10. And according to the EU directive, this contribution can be subtracted when we're assessing the compliance with air quality limit values. So you can see here that when they remove that transboundary dust, which is shown with green, that level went below the limit, and therefore the exceedances dropped to less than 35 for most of the years. And that's very important for policy implications, especially within the EU. Now in Cyprus, the dust, in Cyprus we experience around 30 dust days per year. And this graph shows the annual frequency of dust storm from 2000 to 2017. Blue are all dust days, and red are the dust days where the PM10 levels at an urban station exceeded the daily limit. We observed an increase in the number of dust days from 2000 to 2010, where in 2010 we had the peak. However, in 2008 was the year with the highest number of dust days, where the PM10 at urban station exceeded the daily limit. 2010 was then followed by 2 years of the low frequency in 2011 and 2012. Now, when we looked at the whole study period from 2000 to 2017, we did not find any statistically significant trend on the dust frequency that occurred in Cyprus. Now, in Cyprus, the dust season is usually late winter and spring, and less frequently in fall. So we have this dust seasonality for quite a few years now. Now, we mentioned before that 2010 was the year with the highest number of dust days, but it was not necessarily the year with the highest PM10 dust levels in our time series analysis. Here we see the distribution of PM10 levels during dust storms from 2000 to 2017 from the background site measurements. Again, here 2008 was the year with the highest PM10 median of during dust storm, and this year was also the year with the lowest precipitation that was observed within this time period. However, looking in the trends analysis, we found no statistically significant trend of the intensities over the last years. Wrapping up, Cyprus is highly affected by transported dust, desert dust from the two largest deserts in the world, from the Sahara and the Arabian Peninsula, the Middle East deserts. We observed a high variability in the frequency and intensity of the dust characteristics, but we did not observe any significant monotonic change of the dust storms over these last 2 decades. However, the year with the highest dust intensity was the year with the lowest precipitation. And that actually agrees with Professor Koutraki's presentations and findings in Kuwait that say that precipitation is related to the intensity or frequency of dust storms. Other countries and studies that they looked at the trends found different things. So one study that looked at the PM10 dust contribution, the African dust contribution, to the PM10 increase in Cyprus, found again no change in the trends. However, the trend analysis for dust differ across studies, locations, and time periods. So, for example, a study looking at the frequency of African dust in the southern eastern Mediterranean found an increase in the frequency. Also, an increase in the intensity was found in Israel, where a decrease in the frequency was found in Spain, and a historic reanalysis for over 100 years found a decrease in African dust emissions. A recent model projection by Lelivat and others in 2014 suggests an increase in dust storms events intensity on the overall. I think that future studies should focus or examine the dust storm characteristics over several decades in order to see a more pronounced maybe pattern and look at the relation to climate change. However, the future of this phenomenon is still very unclear, and it will probably depend on the anthropogenic pressure on desert surfaces, as we saw before from Professor Kutraki's presentation, of course, the natural climatic variability, and climate change. Thank you, and I also thank my research group, collaborators from the Life Media project that they helped in this time trends analysis. Okay, so I think this concludes the first session with the three first presentations, and I would like to invite the rest of the presenters to join me to answer any questions. So please, if you have any questions for any of the previous three presentations, please put them in the Q&A chat. We have a question.
one question so far. Do you see it? If you click Q&A, the question is, what do we know so far on the impact of air pollution on eye health?
Yes. I don't know if anyone wants to respond that, and I don't know if we should leave that for tomorrow, where we're going to talk about more about the health effects.
There is a paper by Joel Schwartz group published last year about eye health, and unfortunately the name is anonymous, so I cannot send them the paper. But I can give the reference tomorrow because I don't have it with me now. But there is a paper, and that paper has some references, so I can find it.
Thank you, Pedro. Maybe we can post it in the Q&A later on. I would like to ask Dr. Ali, though, to tell us maybe a little bit more about his mitigation measures because we had to cut a little bit to finish earlier. Dr. Ali. Hi.
Yes, hi. Regarding the mitigation measures?
Yes, so you said your mitigations were actually plant trees, right?
Yes, actually the mitigation, we have used two approaches. First, if we want to protect a certain area, a vital area, for example, we want to protect the airport, or if we want to protect an oil refinery, we need to put blocks, fences, two types of fences, maybe let's say 200 meters to 500 meters before the vital area. And these two fences, we plant in between them. And the fences must be manufactured in a specific way, because actually we have used different types of fences with different holes. And it was like we call it double-stranded fence. And between the two fences, we put trees, which really native trees, because in the desert, we don't have fresh water. So it must be trees that are native to the area. Now, this story was successful in Kuwait, because this area, which I showed before, this was one of the heaviest dust storm spot affecting urban areas. Especially, we have one urban area called Al Jahra. This urban area was directly below this hotspot, maybe about, let's say, 20 kilometers. And mostly the wind in Kuwait is from northwest direction. So from northwest directions comes into this desert area, into Al Jahra urban area. And the people were suffering, mostly loss of hospital admissions and so on. After we have mitigated and enhanced this area, and as I showed in the pictures with the students and so on, now I can tell, and actually from historical records, this Al Jahra area actually is the most air purified in Kuwait. We have looked into the PM 2.5 and PM 10 in all of these urban locations where we have monitoring stations. And now Al Jahra is the clear and the most clean area. Now we want to send this success story to Iraq. And by the way, Kisar, my work, we have contacted the United Nations Habitat, which are based in Kuwait, the UN Habitat, as well as with Harvard University, as well as with Iraqi Southern universities. And we have collected a team to target and mitigate this hotspot area through the UN Habitat. And this project now is looked into from Kuwait Fund for funding to rehabilitate and mitigate the dust storm which come from Saudi Arabia, from southern Iraq, where really this southern Iraq spot does not only affect Kuwait, as I said, it goes all the way to Saudi Arabia, Bahrain, Qatar, Emirates, and hopefully we can do the same thing there.
Okay, thank you. That's very promising. I have one question, and then before we go to the break. Is there a specific definition of a dust storm day? PM levels over a certain level, do dust storm days also get described by other characteristics like length or something related to the absolute level? Does anyone want to answer, or?
Yeah, I can answer that.
Yeah.
Yeah, actually, in dust storms are definition of a dust storm when the visibility is below 1,000 meters. For example, now in Kuwait, we have 3 types of dust storm. We have one which called severe dust storm when visibility is up to 200 meters. We cannot see more than 200 meters. This is severe visibility. Now between 200 to 600 meters, we call it normal visibility. And between 600 to 1 kilometer, in other words, anything below 1,000 meters, this definition is a dust storm. And this definition is by the World Meteorological Organization, as well as from pioneer experts in the area. I can share with you the definition of their names. So the dust storm is related to visibility, and also not only visibility, it has to do with the wind speed. The wind speed must be more than 8.5 meters per second. So when there is high wind speed and low visibility, this is called the dust storm. Now, for example, in Kuwait, sometimes we have high wind speed, but the visibility is good. The visibility is, we can see more than 1,000 meters, but the wind is very high. This is not called dust storm, but this is called rising dust or blowing. It's a blowing dust or rising dust, because we can see much farther, although the wind speed is high. And also there is another definition. I can send you the references. There is 2 good papers by Hoffman. I think Hoffman in 2008. There is Hoffman 2008A and Hoffman 2008B. He has a definition of dust storm based on visibility, and also he includes PM10 in it. And I can share you these 2 articles.
Thank you. And I think different studies using a different definition, which that's another differentiation across the studies, and different, let's say, PM10 cutoff point. Of course, that cannot be one number, but it depends, of course, on the PM10 background levels and how much the intensity of the dust is coming. But in general, there are different tools that you can use to identify dust from PM10 trends. Usually, that's a good indicator. Other tools besides visibility, satellite data, or any other projections of air masses. I think we have one more question, Professor Dr. Ali, before we go to the present break, just a very short one. If you can briefly answer how much the hotspots move around and how predictable they are over the years.
Sorry, this question for me, or if you can?
Yes.
Yeah. Can you repeat it, please?
How much the hotspots move around and how predictable they are over the years around Kuwait. The hotspots.
Yeah. Now the hotspots around Kuwait, we have we can say two major hotspots. Two are in southern Iraq, and one is in East Saudi Arabia, which was one researcher has identified past 3 years east of Saudi Arabia. Now these hotspots are generally, we can say, generally stable, because with extreme wind erosion, we usually the sources become sand dunes. Now, when there are many sand dunes, generally, not always, they have coarse particles, and these coarse particles heavy, does not go long distances. But over the years, we have noticed, and also Dr. Petras mentioned, that the hotspot in Iraq has been with the vegetation, with the improvements after the war. There was a lot of improvements in vegetation and so on. So it's shrinking. It's shrinking from the sides, but still the middle of the hotspot is the most severe. So in other words, to answer the question, hotspots, they could expand or they could shrink depending on the vegetation around them. But from our experience, because this area we have visited in Iraq, and this area, by the way, it's huge. It is like two-thirds the size of Kuwait. It's a very huge area. But over the years, it did not expand. It shrank because there is rivers also there, and there is vegetation. But the severity of the area is still there, still intense. Any high wind speed affect all the way, the northwest direction wind affects all the way, not only Kuwait, which is 200 kilometers from Iraq, but goes all the way to Qatar and United Arab Emirates. And this is really dangerous. In other words, it's a regional problem. Thank you.
Thank you. That's very interesting. I think now it's time to take a break before we move on to the next three presentations. So we'll have a 15 minutes break and then we can continue. Let's now continue with our second session of the day, and let's welcome Professor Itzhak Katra from the Department of Geography and Environmental Development from the Ben-Gurion University of the Negev, Israel. Professor Katra is a geomorphologist who is focused on dust emission by wind-induced processes and human activities and the related atmospheric dust distribution from the source areas. He will present some aspects of dust storms in Israel and their impacts on air quality in indoor and in outdoor environments in an arid city located in the northern Negev Desert, Israel. Professor Katra.
Okay, hi everyone. I just shared my presentation and I hope you see it. I will present results from a project of Ben-Gurion University and Soroka Medical Center on air pollution by dust storm in southern Israel and the health impacts. In this presentation, I will focus only on the dust storms and air pollution. Well, we know that dust storms affect air quality, and most of the exposures are in Asia and Africa, close to the global dust belt. But the information on health impacts in these areas is very limited, as we discovered when we started the project. So the project is conducted in Be'er Sheva, which is, we see it as an ideal case to study air pollution by dust and health impacts from two main reasons. One, it can be a case study for the scenario of global warming and Europe climate in the future, or Southern Europe in the future. And you can see the location of Be'er Sheva and the global dust belt and Southern Europe. And the second reason is we have a complete health outcomes access from our regional hospital. So this is an example of dust storm over Israel. And this is a photo from the campus of Ben-Gurion University under a strong dust storm. And you can see the numbers of the PM10 and the PM2.5, which are very high compared to the WHO guidelines. So I will talk about some aspects of dust PM in the urban area of Be'er Sheva. And these are the points. So the basic aim was at the beginning to identify what are dust storms based on PM10 concentration. And we use daily PM data of several years. And you can see here in this graph the peaks of the dust storms over time. And we look on the synoptic data of all the days in this period to exclude the days with the dust event based on the synoptic condition. Then we calculated the average PM value for the clean days which are not the dust storms according to the synoptic condition for each year, and for the total period, which is 42 microgram per cubic meter. This is the average background value for the entire period. Then we added two standard deviation to determine the threshold of possible dust day for further statistical analysis. And after we learned the background value for our region, which is quite high compared to the WHO guideline, we wanted to know what is the relative contribution of anthropogenic sources to the background value. So we know the background value is between 42 and 70 microgram per cubic meter, and we would like to know what is the relative part of the anthropogenic contribution. So we looked on days with almost no activities in Israel, which is mainly Saturdays. But there is one special day in Israel, which called the holiday of Kippur, in which no work and even no traffic on the roads. So this is a very, very clean day in terms of anthropogenic activity. It's the most clean day during the year. And after the analysis, you can see that the dashed line is for the Saturdays and for Yom Kippur, and the solid line is for the weekday with anthropogenic activity on a daily cycle. So we see that the concentration of the contribution of the anthropogenic activity is only 15% from the total background. and most of the background is also dust, is natural particles that are always in the air in our region. So no need dust storms with high wind speed and specific synoptic condition, because we have natural particles in the air all the time. So regarding the dust events, one of the questions is how the event is strong or danger. So you can see here three dust events, and in event F, you can see a peak of about 5,000 microgram per cubic meter. And in B, you can see a dust storm with a peak, a much lower peak of about 2,000 PM10. But the duration is higher compared to this event. So we calculated the intensity of the dust based on the area below the curve. So the greater the area below the curve, the dust storm is more intense and maybe more danger in terms of health risk. So the values are, we define them as AI, and now we can compare between different dust storms according to the AI, which one is more intensive or danger to human health. And aside from the PM values, it was important to us, and still important to us, to know what is in the dust. So we analyzed particle size distribution and chemical composition on a daily basis to get the information on dust. However, we looked also on the biology in dust, which we know very little about this. And here you can see two dust storms that reach Israel from slightly different directions on North Africa, and here the air mass started from Southern Europe, but still take soil from North Africa to the Negev. And we see here differences in the RNA genes of bacteria and karyotic of different dust storms. So this is a very interesting point of view on dust, not only the chemical composition, but also the biology in the dust. And another aspect of dust storms is the distribution of the PM at the city scale. It's a very missing information, because mostly we use monitoring stations at specific point, or we use satellite data, which has a very coarse resolution. And the city scale is the most probably difficult to show and analyze for human health. And what we did here, we performed measurements by mobile PM monitors in a number of locations during clean days. And you can see here the map and the values, and during dust events. This is an example of dust events, and you can see here the values. And we did it in several dust storms to get an idea how the dust and the PM from dust is distributed in the city. The black arrows represent the wind directions. And what we can see here, that in most cases, the PM10 values were higher at the areas in which the wind dust came from. Okay, so this is an example. The wind came from here to the city, and the dust concentration were higher at this area compared to the other areas. And maybe the most important aspect for health risk is the indoor air pollution, where most people spend most of their time. So we aim to know what happens at homes when a dust event is generated outside. We made a simultaneous measurements in outdoor and indoor of houses in Be'er Sheva during clean days and during dust events. And what we can see here is that during dust events, these two graphs, PM 2.5 and PM 2.5 to 10, that the indoor PM is clearly controlled by the outdoor PM compared to clean days, to receive much higher values also in the indoor environment compared to the non-dust days. And this is an example of how the PM looks inside home during a typical strong dust event. In the left side, you can see the monitoring station in the center of the city with the PM10 data of the entire event. And in the right side are the results of real-time measurements in several houses during this event. And the black solid line is the outdoor PM10 value near the houses. It's an average of several houses, and we measure in each house outside and inside. And the solid red line is the indoor PM10 concentration of the houses. And it follows clearly after the outdoor PM10. And this is true also for the PM 2.5. And we can see that the high concentration of PM in the indoor environment can last for hours during the dust storms and maybe after that also. And we need to think about this because when people stay at home during dust event, they're actually not protected. So this is the last slide to show some works that we done on the impact of the dust events in our region, in Be'er Sheva, the impact on human health, which I think Professor Novak will talk about them more later. So thank you for listening.
Thank you very much. I think before we go to the next presentation, if there's not any immediate question, I would like to ask a question, Professor Katra. So we saw before with Professor Kudraki's presentation that the indoor levels or the penetration was lower during dust. However, in Israel, you find that that's the other way around, right? So during dust storms, there is more dust coming in, even people stay home inside.
Can you say it again? I didn't follow.
So I don't know if you have if you joined us from the beginning, but Professor Koudragis showed the indoor-outdoor what they did for Kuwait, and what they found is that the penetration of the particles decreased during dust storms because people were closing doors and windows. But if I get it right, this is not the case for Israel, right?
Actually, people close the windows and everything, but still the dust is penetrate into the houses. It's normal houses, I think, like in most places, and still the dust is penetrate. I think it's very depend on the wind speed. When the wind is relatively strong, the dust penetrate from the windows and below the doors.
This is Victor Novak. Can you hear me?
Yes.
So just to reiterate, I think that what Professor Petrakis showed it is that the ratio is different between indoor, outdoor, between the dust and no dust time intervals. What we have shown it is that approximately, just the rule of thumb, approximately 50% of the dust will penetrate indoor during the dust storm event. So it's slightly different. And on top of this, I think that Professor Carter's work is very useful because it also allows you basically to make some equation to assess the indoor dust concentration based on outdoor measurements, because it's obviously a problem to all of us. How do you assess indoor concentration? And in his work, he shows that, for example, the rugs, the carpets, the pets, all this can actually increase a bit the dust concentration indoors.
And if I remember well, because I might be wrong about this, but you in Israel, you had more apartments in buildings as compared to Kuwait, where we had single-family homes. And if I remember, some of your apartments were like third, fourth floor. And maybe that it makes a big difference. You have higher winds and more exposure. So I don't know.
It might be. Also, Petros, we have never been to Kuwait, but you've been here probably. You know, the sort of the quality of buildings is not that high. Actually, there are a lot of gaps and, for example, under the door, which is kind of the main source of the dust probably in the household.
Yeah.
So, yeah, so that's not the best out there. Another interesting topic, of course, would be the air conditioning and how air conditioners work and in our area and in our region. That would be a very interesting topic. I don't know if somebody will address it.
Yeah, air conditioning in Kuwait is very powerful, very reliable, and I guess also the conditions during the dust storm might be different. Like, you know, do you get your dust events come with very hot air, or what kind of meteorological conditions you have during your dust events?
Professor Carter, I think it's for
it?
you. Oh, what are the meteorological conditions during the dust events?
Like
what
it's
are the
very
predominant
hot,
winds?
Yeah.
Yeah, it's mainly a low pressure system.
Okay, so I mean, okay. Mm-hmm.
Yeah, mainly.
Those are not hot events,
Yeah.
usually.
Yeah.
Exactly.
Yeah, the strongest dust storms are with the cold air.
Yeah. Good, thank you.
Okay, thank you for your input. Actually, it's very interesting. Okay, so let's move on to our next presenter, and let's welcome Dr. Wasim Javed. Dr. Javed is a research scientist in the Department of Mechanical Engineering at Texas A&M University at Qatar. His research focuses on aerosol monitoring, sampling, characterization, modeling, and source apportionment, on air pollution research and modeling, on developing strategies and measures for pollution control, and aerosol pollution impact assessment of solar energy health and plants. So Dr. Javed is going to present us the characteristics of particulate matter pollution in Qatar's atmospheric environment. Dr. Javed.
Thank you, Susanna. Hi, everybody. I hope you can listen to me and can see my slides. So,
I hear you very well and see your thoughts.
Okay, so I'm going to present some basic aspects of characteristics of particulate matter pollution in Qatar atmospheric environment. In Qatar, this second slide. So high particulate matter pollution is most significant environmental challenge in the Middle East region due to its arid desert climates. So Doha, which is the capital city of Qatar, also have aggregated particulate matter pollution due to its rapid growth of economic and populations. In comparison to other Middle East cities, particulate matter pollution in Doha is mostly higher and are several fold higher than the WHO limit. However, there is very limited information data related to the particulate matter pollution in the Middle East, particularly in the Qatar. If we say the Qatar is a desert country that is situated on a peninsula on the Arabian Gulf west coast. Its unique geography, climate, as well as the typical petrochemical industries make it unique than the other study area of the world. For this, so in this study, we do the particulate matter sampling campaign in Doha over the 8-month. So from May to December 2015. During this sampling campaign, we collected 24-hour particulate matter filter samples for both PM 2.5 and PM 10. Along this filter sampling, we also carry out the real-time measurement by using the dust track for the aerosol particulate matter concentration, and also for black carbon, we use the atherometer. So annual mean concentration of PM 2.5 and PM 10. PM 2.5 was about 40 microgram per cubic meter and PM 10 was 146. So this average daily PM concentrations exceed several times the WHO limits in 48% of days for PM 2.5 and 90% of days in case of PM 10. If we see the average PM 2.5 to PM 10 ratio, it was about 0.3, so which indicates that about 70% of the atmospheric PM 10 mass was constituted of coarse particles, which is due to the influence of this desert environment. During the sampling campaign, about 20% of days were characterized as the dust storm days, which are having the PM10 more than 200 microgram per cubic meter. During these dust storm days, the both PM10 and PM10 concentration are very high as compared to non-dust storm days. It's about 1.5 to 2.5 times higher during the non-dust storm days. However, it can be seen that PM 2.5 levels during the non-dust storm days were not considerably lower as compared to the annual mean concentration, and it's about close to the annual mean. So it means that the dust storm is not all the reason for this higher PM 2.5. Other non-natural sources are also contribute to this higher PM 2.5 concentration in the area. Regarding the EC and OC contents of the PM 2.5 and PM 10, so we have observed that about 80% of the EC contents are associated to the fine PM fractions, while approximately 70% of the organic carbon was associated with the coarse size particles. So it means these are mostly originating from the vehicular exhaust and other combustion sources. If we talk about the total secondary organic carbons, so the secondary organic carbon account for about 60 to 70% of organic carbon. So indicating that the photochemical conversions of organics to the secondary organics are much active in the area due to the high temperature and solar radiation in this area. If we see the sulfate, secondary ion sulfate and nitrates, so we observed that sulfate is mostly abundant in the fine particulate matter. About 75% of sulfate is situated in the fine particulate matter fraction. In contrast, the 80% of nitrate was concentrated in the coarse particles. So this significant high concentration of this sulfate ions in this area that indicates that it's about the predominance of intense photochemical reactions processes in this hot arid climate are much common. Similarly, the mass closure of this particle matter, both PM 2.5 and coarse fractions. So we see that the predominance of secondary inorganic aerosols of about 40% is in fine fractions, while the mineral does contribute about 50% to the total mass of the coarse particles. Then we also do the positive factorization model to identify the contribution of these sources. So PMF model it's identified 6 major sources, including the secondary aerosols, vehicular exhaust, heavy oil combustions, marine aerosols, and minerals and fugitive dust. The secondary aerosols and heavy oil combustion, these two sources are mostly contribute to the fine particulate matter fractions, while the mineral dust and fugitive dust have higher contribution in the coarse particles. We also PMF resolved sources were further characterized using the wind data by plotting the conditional bivariate probability functions. So this wind analysis indicates that both local sources such as the vehicular exhaust, which are mostly associated to the low winds, which are these sources are mostly locals, and other sources which are associated to the long distance high winds and mostly from the northwest directions. These long distance regional sources such as secondary organics, secondary inorganic aerosols and mineral aerosols, these are the long distance that impact the Qatar's air quality. The Qatar has a unique wind patterns. If we see the backwind trajectories, most of the winds, about 60% of winds came from this northwest directions that travels over the this Gulf Arabian Sea. So this is mostly these wind corridors, is mostly wind masses originate from these desert areas of Iraq and Kuwait, and they travel over the Gulf Sea and arrive to the Doha. Further, PMF identified sources were characterized by the potential source contribution function plots using the backwind trajectory data to identify the regional sources which are potentially affecting the PM concentrations of air masses arriving to the Qatar. Here we can see that both the secondary air heavy oil combustions and secondary aerosol, they are both related to the regional emissions. from the shipping-based vessels and petrochemical industries in the Arabian Gulf region. While the other two, mineral aerosols and marine aerosols, these two are long distance sources that also associated with the strong winds coming from the northwest directions under the transport of air masses from the sea. The distant sources, like in Iraq, desert area of Iraq, Kuwait, located to northwest of Doha, are the potential source of this mineral dust. Similarly, marine aerosols, these are northwest and east direction of this Doha. These are associated with the air masses from the sea. Along this filter samplings, we also measure the real-time PM concentrations by using the real-time dust track monitor, aerosol monitor, over the last 6 years at the same sampling site. The dust track measurements were compared and corrected against the gravimetric measurements. You can see the dust track have high precision, show the high precision, but its deviation is more from the gravimetric method. So dust track overestimate the PM10 concentration by 2 times, and while it underestimate about 20% as compared to the gravimetric method. So these proposed correction factors can be used for biocorrections of dust track monitors. So by using this, we also corrected our dust track measurements data and analyzed the temporal trends over the 6 years sampling campaign. You can see the diurnal trends. So we see we have a sharp morning peak around 8 a.m. And then this concentration of these both PM fractions decrease until to the afternoon around 4 p.m. and then again rose during the night time. This morning peak mainly may be related to the increased boundary layer height, less boundary layer height during morning, and this decrease during the daytime is associated to the increase of boundary layer height. This increasing boundary layer height provides the more volume for dilutions, so which lower the PM concentration from morning to the afternoon. Similarly, we this morning, one thing, this morning peak is not associated to the traffic rush hours, because we also observed that this morning peak is also during the weekend days, which have very less traffic during this weekend, Friday. Regarding the seasonal monthly trends of this PM levels, so higher particulate matter levels during the summer month, like June up to September. So these months are characterized by frequent dust storms and very low rainfall. If we see the frequency of dust storms, so mostly dust storms are frequent during these summer months, and in opposite these months have lower rainfalls during this month. These two lines, the red line indicate the PM10 concentrations overall during the whole sampling period, and this black line is the PM concentration without the dust storms, and the difference between these two lines indicates the relative contribution of these dust storms. So here we found that about 5 to 25% of this difference is contributed by the dust storms. So on average, 60% of PM10 mass is contributed by the dust storm days. To analyze the annual trends. So first way to see the annual trends. So first we normalize our PM data against the meteorological variables by using the boosted regression tree machine learning techniques. So this model de-weather the or minimize the influence of meteorological variable on the PM variations. So if we see the meteorological variables, so relative influence, the wind, dust storms, wind speed, and relative humidity. These are the most important weather variables which affect the PM variability. Here we see the annual trends from 2014 to 15. So the 2015 and 16 were the most polluted years. We have a higher concentration of both PM 2.5 and PM 10. So over the 6 years, from 2015 to 2019, we see the general decreasing trends. In case of both observed PM fractions, PM concentrations, and the normalized concentrations. Like compared to the 2015, the annual average of weather normalized concentration in 2015 is a decline of 26% in PM 2.5 and 15% reduction in the PM 10. So the model also gives us the relative decrease of both fractions per year. So PM 10 decreased about 2.5 microgram per cubic meter per year. Similarly, PM 10 also decreased 4.8 microgram per cubic meter per year. So we see general decreasing trends, but the concentration is still very high. So it's very high than the recommended values. So the more then the next. Okay, thanks. These are.
Thank you, Doctor.
I finish within time.
Yes. But I think we will move on to the next presentation and then we can take questions at the end. So our next presenter is Dr. Jing Li. She received her PhD from Peking University and now she's a postdoc fellow working with Professor Petros Koutragis at the Harvard H. School of Public Health. Her research focuses on the application of remote sensing in environmental exposure modeling, and she will present us the environmental characteristics of Iraq and Kuwait.
Okay, hello everyone. I'm very glad to participate in this meeting. And today my presentation is estimation of ambient PM 2.5 in Iraq and Kuwait from 2001 to 2018 using machine learning and remote sensing. This paper was just published by Environmental International recently. Here is some background. Since 2001, nearly 3 million US military personnel have been deployed in support of operations in the Middle East. Although the soldiers deployed to Iraq and Kuwait were exposed to high levels of PM 2.5, but the lack of a ground-based PM monitoring network has limited the assessments of health. The aim of this study is assessing the daily PM 2.5 exposures for Iraq and Kuwait, which could help the design of health effect studies, both in the native populations and the previously deployed soldiers. Satellite-based AOD has been widely used to estimate PM 2.5 because it has high spatial and temporal resolutions. But this method has not been applied to areas with which lack of PM 2.5 monitoring sites. In our study, we developed a calibration model to convert visibility to PM 2.5 based on satellite AOD. And our approach takes advantages of the large data set of historical visibility collected by the airport and the high spatial temporal resolution of satellite AOD. Our study period is from 2001 to 2018, and we collected some global public data set. the AOD and visibility and the PM2.5 are the most important variables in our model. We collected MAYAC AOD from NASA with a 1 kilometer spatial resolution and with daily temporal resolution. And we got visibility from more than 200 US Air Force airports. And we also got PM2.5 monitoring data from Howard sampling project. And we have 3 sites for 2004 to 2005 and 2 sites for 2017. And we also get the PM2.5 monitoring data from EPA US Embassy Kuwait. And we also collected some other variables as co-founders, such as dust variables from NASA Array 2 dataset and the land use variables such as NDVI, road density, distance to industrial areas. Also, we collected some meteorological data to control our model, and this meteorological data were from EIA5 reanalysis. Here is the map of our visibility stations, and here is the PM2.5 sampling informations in Kuwait, and a total of almost 2,000 valid PM2.5 observations were used in our study. In order to estimate the daily PM2.5 at 1 kilometers, we developed a hybrid model, including 4 stages. At the first stages, we use a machine learning method, a random forest model, to predict the visibility based on AOD and controlled by other variables. In stage 2, for grid cells with AOD, but without visibility measurements, we then use the high spatial AOD to predict the visibility for each 1 kilometer grid cells. And for stage 3, because some grid cells also didn't have AOD, so we used a generalized predictive model to predict daily visibility based on to predict the AOD for that grid cells without AOD. And in the final stage, we calibrate a model to predict PM2.5 with AOD. And finally, we use the model to the hybrid model to predict the 1 kilometer PM2.5 exposures. And here is our model performance. For stage 1, we performed a 10-fold cross-validation to evaluate our model and avoid overfitting. The CVR square for our model is about 0.7. And the random forest model is a popular used model to predict PM2.5 based on AOD, because it can give us the important variables for the model predicting, which could give us many suggestions. In our model, we found that AOD, year, and some dust-related variables are very important for the model in Kuwait and Iraq. And here is the performance of our stage 4 model. Its R-square is about 0.7. And here is the long-term variation of our satellite-derived PM2.5 and the ground-observed PM2.5, indicating our model could predict the PM2.5 in this region with good performance. And here is our result. We found considerable spatial variations over the study region, and the annual PM 2.5 concentrations for the study period, and for Iraq and Kuwait were 37 and 41 microgram per cubic meter respectively, and which was much higher than the US air quality standard and WHO guidelines. And we found the highest annual PM 2.5 concentrations for both Kuwait and Iraq will occur in 2008 and followed by 2009. We think it is possible that the extremely drought in 2008 and 2009 contributed the high PM 2.5 levels in 2008. And we found the lowest values in 2014. It is possible that the heavy rain in the end of 2013 contributed to lower levels in 2014. For monthly result, we found July had the highest predicted concentrations as November had the lowest values, which is consistent with seasonal patterns of the PM 2.5 observations. This map shows the mean PM 2.5 concentrations in each 1 kilometer grid cells during the entire study period. And in general, the PM concentrations in Kuwait were slightly higher than Iraq. And as expected, the predicted PM 2.5 concentrations were higher in the urban area than the rural regions. And some big cities had very high annual PM 2.5 concentrations. And to be noticed, many US bases were located in these big cities. In contrast, some bases were located in regions with lower PM concentrations, such as the west of Iraq. It has PM 2.5 concentrations below 13. Here is a map for the predicted PM concentrations for each year. And we can see in 2008 and 2009, for the whole region, the PM 2.5 exposures were very high. And for some years, such as 2004 and 2014, the exposures were relatively lower. In order to show the details of the exposure data, here we show the weekly average PM 2.5 concentrations at some important locations. Here is for Baghdad, Iraq, and we can see the weekly PM concentrations ranged to more than 115 in summer of 2008 and 2009. And also there are some high values in the other times. Here is a map for the other US base in Iraq, and here is the visibility weekly average exposures at the Kuwait International Airport. We also compare our exposures with the other PM 2.5 measurements studies, but there are very few studies conduct PM 2.5 measurements in these regions. And we found some papers and compare it with our result. We found our result has the same spatial distribution with the other research studies and consistent with a previous WHO air pollution database. However, the PM 2.5 concentrations in our study are generally higher, are generally lower than Dr. Ali's paper. I think maybe it's because in the monitoring data, they always only selected the PM 2.5 values above a minimum background to report. This is our data set, and our data set has some major findings that are of public health significant. In previously, the PM 2.5 and the AOD relationship was directly used to examine the distribution of PM 2.5, but this method only applied to countries with a lot of PM 2.5 measurements. For the countries' lack of PM 2.5 measurements, our study indicating that it is possible to assess the exposures with AOD and visibility. And secondly, our random forest model also provided the relative importance of each factors associated with historical PM 2.5 concentrations, which is very important for our future study. And to be noticed, the dataset used in our model are all global public dataset. So it means our model can be used to any regions across the world. And we can use this method to predict the PM 2.5 exposures for any other countries. And to the best of our knowledge, this is the first model to estimate historical PM 2.5 concentrations at a high spatial resolution in these regions. And thank you. I'm very glad to take questions.
And this data can be available to people in the region that they want to do any kind of health studies. So that's something to keep in mind.
Yeah.
I wanted to ask about that. Is there any restrictions about the use of the model? Or it can only apply in arid and semi-arid areas?
It's daily data set.
I don't think it's, I think it's fine. The only problem, I mean, the advantage of using the visibility data in the Middle East in this region is because it's the relative humidity is low, but there are parts of this area that the humidity is not that low as compared to the United States. And the other advantage is that the concentrations are higher, which means that the visibility data, we can get some meaningful relationships. In United States, using visibility these days from the airports is not it does not really work because the levels are low and some of the areas are very humid.
Thank you. And so now we can answer any questions that participants or the panelists may have. So just to start the discussion going, I want to refer or ask a question to Dr. Javed. You presented your results and you show a downtrend of dust events using a 5 years data. I just wanted to ask if you have any plans to perform maybe a longer term analysis. Is that a possibility, or is there any restrictions on data availability or something?
Yeah, yes, we have plans. So regarding the filter sample analysis, or I'm not fully understand your question.
The trends analysis that you did.
Analysis, yeah. So we have first we did the 8-month campaigns, and this year we also did another one campaign. So 1-year campaign. So we just compare the 2015-16 data and 2019-20 data. So just comparison. So 1 year, 2 studies. So we have planned to compare these trends over these 5-6 years, not the continuous over the whole years.
So you're planning to extend it, right?
Yeah, yeah. So yeah. So we.
So if we don't have any more questions, or we can address them later if questions come up, then I think it's time to take a a 15-minute break. And then we can resume back at 5:50.
Okay, yeah.
Thank you. Welcome back, everyone. We'll continue now the webinar, starting with the third and final session of the day. And let's welcome Dr. Purnima Prabhakaran. Dr. Prabhakaran is currently additional professor, head environmental health, and deputy director of the Center for Environmental Health at the Public Health Foundation of India, where she leads a team of nearly 20 researchers and consults on research training, advocacy, and capacity building for environmental health issues. Dr. Prabhakaran's presentation is going to focus on regional pollution for India.
Good morning, good afternoon, and good evening to participants from around the world. Thank you for the introduction, Chair. I am pleased to be part of this forum here today, and at the outset would like to thank the organizers for the opportunity to be here and present on behalf of my colleagues at the Center for Environmental Health in the Public Health Foundation of India and the Center for Chronic Disease Control, which is a sister organization which actually predates the Public Health Foundation of India. Can you see my presentation?
Yes, but is it possible to have it full screen?
Yes, I'm going to do that in a minute. Yes. Just wanted to confirm. Thank you. Yes. So unfortunately, I didn't have a chance to listen into all the speakers because of scheduling conflict, but I'm sure they were very insightful presentations. I did listen to the inaugural session though. So today I'm going to speak about work that's done in our center, centering around modeling of air pollution and health effects in India. And for those who are not familiar with the situation, India is now got the dubious distinction of being the air pollution capital of the world. According to the WHO, 15 of the 20 most polluted cities in the world are in India. Not so long ago, we were known as the diabetes capital. So we often wonder, is there a way to draw the links now? So India's trends in air pollution is what is shown in this picture here. This is India in 1998, and this is nearly 25 years later. And you can see from here that if we go with the WHO annual exposure guidelines, 10 micrograms per meter cubed of PM 2.5 particulate matter, 99% of our districts will be above the WHO guidelines. Even if we were to go with our own less stringent national ambient air quality standards, 60% of our districts will be above the ambient air quality standards. And the distribution is pretty unequal, but no part of the country is really free of poor air quality. And the worst parts of the country are here up north, which is known, this is known as the Indo-Gangetic Plain. And this is always at the center of discourse around deteriorating air quality come winter every year. So sharing here some headlines for India. This comes for 2017, but from a publication in 2019. The annual population weighted mean exposure to ambient particulate matter, PM 2.5 in India was 90 micrograms per meter cubed, which is more than twice the recommended values if we go with our own ambient air quality standards in India. The Indo-Gangetic Plain, which I just showed you in the picture before, has the highest exposure. But it's not just the problem of ambient air pollution. India also has a big proportion of the population using solid fuels, unclean fuels for cooking, lighting, heating. In many states across India, almost 50% are using unclean biomass for cooking. And thereby, household air pollution is really another big problem that often gets missed out in the discourse. In some states, it exceeds 75%. These are states that have a lower social development index. And in these states, the poor air quality is more predominant. So expectedly so, we have something like 1.2 million deaths, 1 in 8 total deaths that can be attributed to air pollution in India. at least 0.67 million from ambient particulate matter pollution, and another 0.48 million from household air pollution. So the problem is actually doubled. We have both the problems to deal with. A stark statistic that we should be worrying about in India is that more than 50% of the deaths are premature. They occur in individuals less than 70 years of age. And that is certainly not good news for a growing economy like India, because it cuts right at our demographic dividend, our working population. And an average of 1.7 years loss in life expectancy is what has been documented. Intuitively, we think about air pollution as causing respiratory effects. And I'm sure there were other speakers before me who might have talked about it. And they might have also alluded to the problem of chronic diseases. Chronic diseases are now being linked to air pollution. And what is known in this regard? Air pollution affects the heart, the brain, the peripheral vessels, causing diseases, causing conditions like gangrene. And of course, what is already documented is the chronic pulmonary obstructive disorders. But increasingly so, evidence is coming from around the world about other conditions resulting from exposure to poor air quality, including heart failure, dementia, cognitive impairment. And this is again a problem for India, where pregnant mothers exposed to poor air quality are being shown to have poor birth outcomes. And again, that is a problem of plenty now for us. What about intermediate disease risk factors like hypertension, diabetes, and obesity? It's certainly a cause for worry because Indians have one of the highest risks for cardiovascular disease and diabetes in the world. Like I mentioned before, we were known before as the diabetes capital of the world, but today we have this dubious distinction of being the air pollution capital of the world. So the mechanisms of increased risk for CVD from air pollution, this is a summary of findings, again, coming from evidence mostly from developed countries about the mechanism and the pathogenesis of air pollution and cardiovascular disease. What has been shown is that the impacts of particulate matter are at the very cellular level on endothelial dysfunction, causing inflammation and abnormalities of heart rhythm, leading to metabolic abnormalities, atherosclerosis, which is a hardening of arteries and deposition of plaques, hypertension, arrhythmias, which is irregular heart rhythms, and leading to ischemic heart disease, peripheral vascular disease, congestive heart failure, arrhythmias, and sudden death. But oftentimes, policies are not made because the evidence doesn't come from your own country. And this question has been repeatedly asked. Do we have evidence in India for the health effects of air pollution? The answer is a partial yes, because we do have studies now linking maternal exposure and birth outcomes. We have studies linking adult exposure and respiratory health. There are studies, cross-sectional studies, that have started linking acute air pollution episodes when the peak of poor air quality occurs, linking it to rise in emergency room footfall for acute respiratory infections. We also are part of studies from the Global Burden of Disease Estimates that is put out every year by the Health Effects Institute, but they use exposure response functions using data from developed countries. So what do we really need now is evidence base from contextualized research in India. Do we have contextualized local studies based on exposure assessments, modeled or measured air quality, and longitudinal data sets of health outcomes in India? In the hierarchy of research, this is not news to this audience, it is the randomized controlled trials and longitudinal cohort studies that are of importance and of higher value. So what can be done and what have we done so far are the questions that come to mind. And what more can we do, and together is what we always ask ourselves. So I want to step back a little bit in time to tell you about this study, which was established in 2010 as a collaboration between the Center for Chronic Disease Control, PHFI, All India Institute of Medical Sciences, which is a tertiary care institute in New Delhi, a Madras Diabetes Research Foundation in India, and Emory University in USA. So with joint funding, this collaboration established a longitudinal study to look at cardiometabolic risk reduction in South Asia. Two metropolitan cities, Delhi, which is our capital city where I live, and Chennai in the southern part of India were selected to be studied. And about 8,000 adults in each city over 20 years of age were sampled using a multi-stage cluster random sampling and stratified for gender. So I won't go into the details, but just to show you in this graphic, like this is the example of the city of Delhi, which is the capital city and always at the center of discourse, whether it's WHO or national governments or international media that are talking about poor air quality in Delhi. So the city of Delhi was sampled, 9 districts, which is about 140 wards, what we call wards. And within those wards, the census enumeration blocks were selected, 20 households and 2 participants, 1 adult male and 1 adult female. And from 2010 onwards, every year, these 8,000 adults were visited and an annual survey was conducted. Each time there were extensive phenotypical exposure assessments done, which range from anthropometry, blood work to look at fasting glucose, lipids, blood pressures, a whole lot of work that was done, and a rich repository of data on cardiometabolic risk factors has been established with this cohort study. A second cohort was actually established in 2014 and has also been followed up. So here we have a longitudinal data set of Indian adults with a rich repository of metabolic risk factors and data followed up in time. It was around this time that the conversation around air pollution was heating up. So 2015, 2016 was known as the airpocalypse, when Delhi experienced one of the worst years of air quality. And fortunately for us, with the Harvard School of Public Health, the principal investigators were Professor Joel Schwartz and Professor Richard Cash. With our investigators in PHFI, were able to win a grant from NIH to establish one of 7 geohealth hubs around the world. And given the contextual and topical relevance of the issue of air pollution, the goal of this grant became to establish a fully integrated research and training program on air pollution and cardiometabolic diseases, which would have policy relevance and improve the health of Indians. So the main objectives of this program were to conduct robust exposure assessment of PM 2.5 at very fine spatiotemporal resolution, link this exposure to the cardiovascular risk factors and outcomes that we had already in this longitudinal study. And in the course of this work, also build capacity in the science of air pollution for Indian researchers. So I will use the example of the city of Delhi and show you what we did for Delhi to link PM 2.5 levels to incident CVD risk factors and outcomes. We've completed this work for the city of Delhi in North India, and the work is in progress for the city of Chennai. So what my colleagues did here was to develop an exposure model to predict daily PM 2.5 concentrations at a very fine spatial resolution of 1 square kilometer for the city of Delhi. So this is the city of Delhi, which is divided into a total of 1,600 grids, and with 7 years of information and a little over 4 lakh observations. So where did our information for air quality over Delhi come from? The Central Pollution Control Board is the authority, the regulatory authority in India that works with the Ministry of Environment and establishes ground monitoring stations across the country. Unfortunately for us, for a vast country like India, there is very inequitable distribution of the monitoring stations. So we are blessed in Delhi to have at least 20 to 25, I think, monitoring stations. But this approach utilized not just the pollutants data from the monitoring stations, the daily average PM 2.5 and PM 10, but also satellite data using variables like the aerosol optical depth, vegetation index, UV emissions, apart from emission inventories, as well as meteorological data, temperature, relative humidity, wind speed, etc., and land use data, which utilized information on length of roads, location of bus stops, buses, bus terminals, railway stations, malls, built up area, as well as population density. So all these sources of information were put into this model, which is called the ensemble modeling. This has been done earlier in the US and Israel. I know a colleague from Israel was also speaking here before and may have shared something similar. But this is what was done: monitoring stations data, satellite data, land use variables, and the chemical transport variables, all put into this ensemble model, We have this published by my colleague, Dr. Siddharth Mandal is the person who was trained at Harvard actually to work on this model. And this has been published recently in Atmospheric Environment. So what was the output of this model? So this is what we have from the month of January through to December, every year from 2010 to 2016. We are building it further up to 2020. This is the exposure, the particulate matter PM 2.5 at the spatio-temporal resolution I mentioned before. And you can see as we approach December, the air quality expectedly so is worse. So these are the initial estimates of PM 2.5 over the city of Delhi. So what did we do with it? We had the health indicators already collected on our longitudinal data set, and we started making the associations between the PM 2.5 and the range of health indicators that were there with us. So I will share with you the example of the blood pressure measurements. So we had blood pressure measurements over the 7 years of our study, a little over 3,000 individuals who had blood pressure measurements over time. And what we started looking at the associations for long and short-term exposure to increased particulate matter concentrations and how it associated with the blood pressure of our study participants. And this is what we found. For every 25 microgram per meter cubed increase in the particulate matter, PM 2.5, the blood pressure in our study group increased anywhere between 3.5 to 5 millimeters of mercury. And it was depending on the body mass index. It varied with the body mass index of the individuals. Now this seems maybe like a small incremental increase in the blood pressure, but translating that into what happens at the population level. If we were to achieve our national ambient air quality standards in the city of Delhi, we could potentially decrease the prevalence of blood pressure in our population by 15%. Translating that into what it means in terms of healthcare access, how many more people are actually reaching the health system, which is already overburdened for care for control of the blood pressure. So this is the kind of analysis that we're trying to do now, and hopefully we'll be presenting it to policymakers to show them how the health effects of air pollution are impacting our cities. And there's implications for healthcare access and delivery, as I already mentioned. And there is a need, therefore, for non-personal policy interventions, which can have major benefits. This has also been published now. And this is just a graphic from that paper to show the average increase in both the systolic as well as the diastolic blood pressure per interquartile increase in PM 2.5 over time. And as I said, this has an interaction with central adiposity. That is one of the other risk factors in the Indian population, central adiposity, and the relation between air pollution and blood pressure actually has an interaction with the waist-hip ratio. Analyses are underway and the publication is on the way to getting published, looking at PM 2.5 and the fasting plasma glucose and the HbA1c as well in this population. While that gives kind of an ecological approach to the exposure and health effects, my colleague Kishore Madhipatla is actually doing a study in a subset of these participants to monitor what their personal exposure looks like and characterize an individual's personal exposure to PM 2.5, black carbon, and heavy metals. And what he did was, within this study, the CAR study, he selected 100 individuals, males and females, living across the city of Delhi, and made them carry in a small backpack an air pollution monitor. The PDR 1500 was the device that was used, along with a GPS-enabled triaxial accelerometer, which would monitor the activity over the 24 hours. So these participants were actually undergoing these measurements over seasons as well, both over summer and the winter. And it is an interesting group of participants, male, female, and coming from very different professions. There were drivers, a carpenter, electric technician, a farmer, a flower seller, you had the entire profile of the working class over here, drawn from the city of Delhi, both from urban as well as non-urban slums populations. Pregnant women were excluded, as well as smokers. These are interesting findings that came out of this study. So this is a graphic of the activity and exposure profile of an office assistant who lived in the eastern part of Delhi, and in her commute to her office and back over the course of 24 hours, we had her exposure to PM 2.5. And the classic findings of how they varied when she was commuting, when she was cooking, and it was lower when she was sleeping. So this gives a very insightful picture of what an individual's exposure profile looks like. And it was interesting to see how this actually, as expectedly so, informal sector employees had worse exposure. But also within a household, there was an example of one household where the husband and the wife had very different exposures, and this can be attributed to her using the unclean cooking fuels and being exposed within a one-room tenement to high levels of air pollution. So that was an interesting finding. Of course, it's a very intense and very high resource study that to do, but it gave us some very insightful findings. As I mentioned, as part of the GeoHealth Hub, we also have focused on capacity building initiatives. We had short-term 1 to 2 week training programs for health system professionals. And we did this through established linkages, both nationally and internationally. We had exchange programs for students and researchers going to various universities, not just in the US, but as well as in Israel and Australia, besides Europe. We also gave out medium-term pilot grants for young researchers to encourage them to do studies around air pollution, and did a lot of career development workshops for our young researchers. We hope in the long term to develop an integrated MPH-PhD program in environmental health, with the ultimate goal being to establish a critical mass of environmental health researchers and policymakers in India. This is just a laundry list of the number of courses that we held from the time the GeoHealth Hub started from 2016. We are now in the last year, so anywhere from air pollution, climate and health short course to this one actually had Professor Petros involved. This was in 2018. We also got researchers from NASA to come and run a short course on satellite-based exposure measurements. So this is a variety of courses that we've been running, and our participants come from very many institutions across the country. Students from different profiles, and this has been a very gratifying exercise, and over 300 beneficiaries till date and growing. We're hoping to make it into a self-sustaining model by moving it into an online model if possible. And we've had participants from other GeoHealth hubs in Bangladesh and Ghana as well. Pictures from some of our training programs, an important focus here on capacity building. In terms of future directions, and these are my last couple of slides, I shared with you the model that was built for the city of Delhi and the city of Chennai using the funding that came from NIH over the 5 years. But in the hope that we could expand this model to the entire country, we established a consortium for health effects of air pollution in India, recognizing the fact that oftentimes exposure scientists and health researchers are working in silos. So in May 2019, along with Harvard School of Public Health, Karolinska Institute, Ben Gurion, Boston University, and the Public Health Foundation of India, we brought together a congregation of health researchers and exposure scientists in India and started talking to them to work with us in establishing this national model and relating it thereon to health effects with using studies that have been done over the years across India. We've also published this as building capacity for air pollution epidemiology in India recently in environmental epidemiology. So the hope is to establish a nationwide exposure model for PM 2.5 based on the successful model built for the city of Delhi, and over a period of 2008 to 2020, covering both rural and urban areas in India. And hopefully from this consortium, we will also have health association studies using cohorts of maternal and child health, cardiovascular health, pulmonary health, cognitive function, and look at a whole range of health outcomes and build the evidence base for India. Fortunately, this group was able to win a new grant to look at climate, health, and air pollution research in India. This consortium will now be working to develop a nationwide exposure model for daily ambient PM 2.5 and temperature, recognizing the close nexus as what the meeting today is focusing on between climate change and air pollution and the core benefits of addressing these two environmental risk factors together. We will be linking our national estimates of PM 2.5 and temperature to health data across India. Currently, we're hoping to look at mortality, cardiometabolic outcomes, lung function outcomes, and many other health outcomes that we are beginning to bring together now. We will also create a public website with environmental data at this 1 square kilometer grid that will be used for both policy making as well as the general public. And in the course of this work, we will engage with stakeholders using a dedicated communication strategy. The significance of this model will be, the results will be highly relevant to Indian environmental health policy. We will open source the model where there will be access to the PM 2.5 predictions, temperature, green space, population and land use data, and hopefully it will accelerate research activity, which is very important now at this point for India. And we hope that it will facilitate public health planning and interventions, increase public awareness, and build capacity through more training programs. We do have some areas of concern, as is in most countries. There are issues for access to data. Funding is always an issue, and sustainability is something that's always there at the back of our mind. But we brought together this consortium, and hopefully we will be working together. I think the one other point that I wanted to put here is, despite the capacity building, unless there is an integration of public health and exposure science, the placements, the demand and supply ratio, the equation may kind of get tilted if we don't work to make sure that all our trained professionals also are usefully contributing to this area of air pollution epidemiology. I will close here with a sincere thank you and appreciation to all my colleagues at the Center for Environmental Health at the Public Health Foundation of India and the Center for Chronic Disease, New Delhi, who are closely working on this important initiative. Thank you for your attention.
Thank you, Doctor. Very important work for the country indeed, and I would like to wish you all the best for your efforts in improving the air quality in India. I have one question related to the PM levels that you showed that are increasing over the years. Do you know, do you have any indication of why is that? Is it because of population increase, or are there any other factors that are contributing to that?
Sorry, I missed what you were asking about the trends, the increasing.
Yes, you showed that the PM trends are increasing over the years. And I was just asking if you know what contributes to that. Is it because population increase? What are the main reasons?
So thank you for that question. So I think it's a combination of factors. Well, yes, the population is increasing, but also we are a very rapidly industrializing nation. So there are very many sources of air pollution in India. I think our industrial pollution, we continue to depend on fossil fuel for our electricity. 70% of our electricity still comes from combustion of fossil fuel. We have vehicular pollution in some of the cities, which is one of the main factors. Construction and demolition, dust. We have a combination of factors, and it's different in different cities. So, but these are the common sources, besides, of course, not to forget household air pollution.
Yeah, thank you. Thank you. Okay, now we can move to our next presentation with Dr. Mazen Malakawi, who is an environmental Health Regional Advisor at the World Health Organization of the Eastern Mediterranean Region Office at the Regional Center for Environmental Health Action. Mr. Malakawi has served since 1988 at different positions in the WHO Center for Environmental Health Action. Currently, he's managing the Environmental Health Exposures Program and supporting the implementation of the Arab Strategy and Framework Action on environmental health. His presentation is going to focus on the WHO predictions and regulations. Dr. Mazen?
I'm Mazen Barkawi from WHO, the Eastern Mediterranean region. I'll be talking about the air quality and health in the Eastern Mediterranean region, the 22 countries of the region, and with some focus on predictions and regulations. To give you an idea about the region consists of 22 countries, starting from the east, from Afghanistan and up to the west in Morocco. About 670 million people live in the 22 countries of the region. And it's quite diverse in socio-economic and conditions, but common in one thing, and it's an arid climate, high levels of indoor and ambient air pollution, to a certain extent, I think, very much similar to what was being described in India. The sources of outdoor as well as indoor air pollution or the outdoor air pollution in the region, the WHO is maintaining a database of ambient air quality in cities. And in that database, we have about more than 200 urban areas reporting their data in 14 EM countries. And it is worth mentioning that we are going on updating this database at the moment, actually. A message is being circulated to the 194 countries of the world, including the 22 countries of the region, that we need to update this the data, because we are embarking on new health impact assessment of air pollution plan for 2021. Along with that, we know that there are a lot of gaps in the region. Some countries still, they don't monitor the air quality. Therefore, WHO developed a composite model where satellite data is being used along with chemical models. And this exposure data is being used to estimate the health impacts of air pollution. Unfortunately, the source apportionment studies in the region are lacking, at least the published ones. And again, I repeat myself, we are updating the WHO database of such studies. I hear so far 2 studies from Kuwait and Qatar that are doing source apportionment. Yani we will be delighted to include those studies in the new database. But from the very little information that we have, we can tell that about 50% of the pollution is natural. It's dust and sea salt. And this is creating a bit of a political problem in the region. Some of the countries of the region tend to believe that dust is harmless and it just can simply be deducted from the PM10 or PM2.5, which is so far the epidemiological sort of evidence is not supporting this. And the whole mixture of pollutants are poisonous and should be included. The other 50% or more sources of anthropogenic sources are transport, power generation, industry, waste burning, particularly agricultural waste burning. Speaking about dust, we have some large cities like Tehran, for instance, where 80% of the air pollution is coming from the transport sector. The indoor air pollution, again, it's chronic, and at least unfortunately in the least developed countries of the region, that still the use of solid fuels and kerosene for cooking, heating, and lighting is a major source of indoor air pollution. A lot of data is available on the use of solid fuels, but very little is available on kerosene, and we are trying to enrich the WHO database by how many countries and how kerosene is being used. About 180 million people are still relying on solid fuel for cooking and heating. We don't know the exact figure of how many people are using kerosene. But equally important, and usually this is neglected whenever we talk about the health impact of air pollution, the other sources of indoor air pollution, like the second-hand tobacco smoke, the construction materials, the furniture, we have the habit of incense burning, and others are not being reported and are not included in the health impact assessment. In WHO estimated in 2018 the following figures, and usually whenever we put this, we start facing difficulties with physicians and others. These figures are based on hundreds of epidemiological studies that were used and systematically reviewed in preparing for the health impact assessment. We know there is a strong evidence to believe that 50% of the deaths from pneumonia between children is caused by indoor air pollution, 36% of the deaths from lung cancer, 35% of the COPD, 34% from stroke, as well as 27% of the deaths from heart diseases are the main cause is air pollution. And we do have causality relationship done through published systematic reviews. Air pollution is a major risk to public health in the region, possibly even more than the other parts of the world, because the level of air pollution is higher. We'll share. In 2018, WHO did, as I said, health impact assessment of joint effects of indoor and outdoor air pollution per each country of the region. And the total number of deaths attributable to air pollution was close to 500,000, about exactly 493,000. IHME, I don't know if you are familiar with their studies, but in 2020, they published their state of the air report. And according to the data coming from the countries, about 589,000 people are dying prematurely because of exposure to indoor and outdoor air pollution. WHO is working hardly on publishing its new estimate, which is planned in 2021. Our expectation that the figures will be higher, but unfortunately the problem is amplifying. This is just an idea about comparing our Eastern Mediterranean region along with other regions of the world. We are the next highest, next to Southeast Asia, next to India and neighboring countries. And if you compare it to the WHO recommended levels, we are almost 5 times. The annual average in the region is almost 5 times the recommended WHO level. If you look at it from a country level, we have, these figures that hopefully will be updated in 2021 by receiving the new data from the countries. This is, again, if you look, portion of the region is still relying on unclean fuels for cooking at the household level. This is the mortality attributed to indoor and outdoor air pollution. As I said, the country is diverse. Unfortunately, the poor and least developed countries are much more vulnerable than other countries. And if you have the attributable death rate per 100,000, you will find it the highest in places where really they are suffering from other emergencies as well. Just to have a look at the status of the ambient air quality standards in the 6 WHO regions, which is a paper published in 2017. They collected all the air quality standards around the world and tried to analyze it in relation to the WHO recommended guidelines. If you look at the Eastern Mediterranean region, out of the 21 or 22 countries, only 11 they have standards for at least one pollutant. We don't say that they are following the WHO guidance, but at least 50% of the countries they have one standard, while the rest, the 43% of the countries, or 48% of the countries, they don't even have a standard, or we don't know if they have a standard. If you compare this with other regions of the world, the region is doing very bad if you compare it to Europe or to the Americas. If you go deep again in that study and try to analyze if we are meeting at the global level or in the countries of the world, if we are meeting the air quality guidelines, take PM 2.5, for instance, which is very much close to the health impacts. Out of the 194 countries, only 62 countries have standards. And out of the 62 countries, only 6 countries are in line with the WHO recommended air quality guidelines, which leaves actually about only 3% of the countries of the world are meeting the WHO guidelines when it comes to PM 2.5. I recommend going into this study. The study was done in collaboration with WHO and others because it really shows how much we are compliant for health protection rather than saying in the WHO guidelines. And the climate change and air quality are very much related, and it's true in our part of the world where really the natural dust is a major component of the air pollution, which and as we know, the duration and the frequency of dusts are increasing as noticed. So climate change is an important potential driver of future wind erosion, and we started noticing it. The simulations, the existing ones, suggest that the global dust emissions have increased by 25 to 50%, mostly in our region. And the unfortunate fact, dusty areas are being affected more than the other countries. Possibly the latest dust event that covered Europe is a good example of what we are facing in some of the countries of the region. The number of dusty days are exceeding even 200 days, which I believe from a health impact assessment and epidemiological studies, it is worth investing some research, because the exposure mode is completely different. If you are facing a dust storm of thousands of microgram cubic per meter, I don't think people will stay in the dust, and we will be shifting. It should be focusing on what is happening at the indoor environment rather than focusing on the ambient level. We've reviewed country profiles developed actually by UNEP a couple of years ago. And the common gaps and challenges that we are facing, that the poor monitoring and lack of available data and communication mechanisms, which I think already highlighted by other colleagues. Poor commitment at the political level. Are we serious in the government in addressing the very serious health impacts of air pollution? Poor coordination between the different stakeholders. And unless we have a holistic approach of dealing with air pollution, I don't think we are going to arrive to tangible effects. As was clearly mentioned in the analysis, most of our standards that we are doing the monitoring according to are not based on health standards. In the WHO, actually, in line with the, WHO issued the global roadmap for addressing health and impact of air pollution, and in our region, we developed a plan of action in order to meet to meet this roadmap, and the plan of action takes into consideration the regional context, including climate and local air pollutants, availability of monitoring and data, and the status of national surveillance systems. And by the way, when we talk about the lack of data, it's not just the air quality data; it's also the health data, because we face serious difficulties in measuring the health outcomes in most of the countries of the region. And the plan was strongly linked with SDGs, with the Paris Agreement, with the Marrakesh Declaration, and with the Arab Strategy for Health and Environment. And thank you for listening. Back to you.
Thank you.
I want to make a comment. Mazen, thank you so much. My computer crashed and I missed half of your talk, so I will go back and read it. But I want to say that I sympathize with the challenges you have there in terms of the resources, in terms of the problems that the region faces, the size of the region, the lack of commitment, the lack of understanding, there's so many things. So I know you're fighting a lot, and I want to tell you myself, and I hope the rest of the scientific community to assist you in any way we can to provide you data from the studies we do or whatever you need us. So thank you very much.
Thank you. Thank you.
We also have a question, two questions for you, Doctor. First one says, it is interesting that Somalia had levels below the WHO recommended pollution levels, but the country had the highest mortality due to air pollution. Is this due to data discrepancy?
If I get your question, you know, so some of the countries, unfortunately, they have double burden of indoor and outdoor. What we know and publicly available is the ambient air quality in most of the countries. But unfortunately, take Somalia, for instance, the level of the more or less about 90% of the population are using solid fuel for cooking and heating, which is again bringing a lot of impact. You know, for when the data that I shared is for the combined effect of indoor and outdoor air pollution. If we put the ambient air in a separate, let me say, graph, the ranking of the countries would look different.
Thank you. We also have another question that can be answered by anyone who thinks can address this in the panel group. Is there any evidence regarding the relationship between particular health effects and source-specific particulate matter? As far as I know, there have been EPA studies done that looking source-specific for particulate matter and health effects, and the health effects are similar to what we study with particulate matter. Of course, the association may be different depending on the source.
This is John Ganneberg. I might add a little bit as well. We've looked at this pretty closely, at least for US sources, to determine if there was certain source types that are of greater concern than others. In some ways, what we have found is that the best indicator for controlling particulate matter is actually mass. It's not mass of metals or mass of sulfates, it's just mass. But that's looking across a national basis because we have a certain goal to have national standards. I think it's pretty clear that there are some metals that are of considerable concern, whether it be lead or arsenic, it's not arsenic, lead or chromium that come from various sources that can be present as particulate matter. So there's no question about that. And in the presentation that I'm going to make, I'll talk a little bit about the hazardous air pollutants, which does include consideration of the different types. But what we have found, at least in the United States, is that the mass has been the best indicator that we have found so far. Thank you.
John, what do you think about black carbon? It's, you know, how it's been somewhat inconsistent, but traffic is driving a lot of it, whatever
Right.
mark you use for traffic.
Right, that's right. And, you know, there has been this debate about just stepping back a moment, that the power industry that was emitting a lot of sulfates and nitrates, or particularly, you know, creating particulate matter downstream, always would point to the traffic as being the source of health problems. And the traffic people would always point to the power plants as being the source of health problems. And so the fact of the matter is, in both cases, you can point to certain types of exposures of greater concern. And so it is a balancing act. And I think that's why, at least at the national level in the United States, we've gone towards a mass-based standard, irregardless of whether it is metals or black carbon or, you know, or sulfates of different types. That's just very satisfactory. Something, please.
The WHO, as part of, you know, during the last 5 years, we were working on updating the air quality guidelines. Mm-hmm. And in order to update the air quality guidelines, you know, we usually base it on evidence, the best available evidence. And in that line, we commissioned 2 systematic reviews. One on the what we call the partial toxicity, or if dust, for instance, is different from other pollutants. And another one was on black carbon. Unfortunately, I'm not going to reveal a lot of details because it is embargoed. The guidelines will be published in April. But what I've seen so far, that we don't have strong evidence to support that black carbon is different from dust. But the whole mixture of pollutants is toxic, and the same relations that you use to estimate the health impact assessment. Unfortunately, particularly in our region, we were expecting something different. We wanted something to relieve the dusty countries, you know, that it's naturally you tend to believe that, for instance, silica is different than other chemicals. But it seems like the drinking water, 99.9 is water, but only 0.1% is pollutant, and the whole drinking water is toxic. I'm afraid that in the IHME, for instance, recent impact assessment, they use the same conclusion, and most probably WHO will use the same at least this is what we concluded from the published literature here and there.
Thank you everyone for your input. And I think now we can go to our next presentation. Last but not least, Dr. John Vanderberg is the Director of the Health and Environmental Effects Assessment Division, the Center for Public Health and Environmental Assessment of the United States Environmental Protection Agency. He is responsible for leadership, planning, and oversight EPA's integrated science assessment. Dr. Vanderberg is going to present and give an overview of the United States EPA regulations.
Thank you very much. Mazen, I think you need to stop showing your screen so I can show mine, please.
Okay. Yes.
Okay. Let's see if this will work for me. Let me know if you see my screen.
Yeah,
yes.
We're seeing it.
Okay, very good. First, I'd like to thank the organizers for inviting me to speak this morning, at least for me, it's this morning. I have had the opportunity to work at the science and policy interface, which is what I'll be talking about today, is how science can inform regulatory decisions and actions to protect public health. And the discussions to this point have had a lot of emphasis on a particular matter, which actually is what I oftentimes talk about, but I decided today to talk about ozone and hazardous air pollutants just to fill out the picture a little bit better. The structure that I'm going to be presenting is the US approach to different management for air pollutants. It's not the only way to do it. So I don't want to emphasize that this is the only way to deal with the management of air pollution, but it does give you some concepts of that. Let's see if I can get this to go for me. So the framework that I'm going to present was developed in the 1970 Clean Air Act amendments, and that was first and foremost to set air quality standards. Those standards then are compared to the environmental conditions that are underway, where monitoring studies, modeling studies, and emission inventory information is central to understanding what is the source of the pollution in the air and how then does it relate to the air quality standards. If we find that in fact there is a need for controlling the air pollutants, then in the United States, we have a delegated responsibility to the states to actually put in place plans to address both stationary and mobile sources in order to meet the standards. And then we employ also enforcement and compliance activities, and we track trends over time, as trends in terms of air pollution, trends in terms of costs and benefits, trends in terms of information that is useful for decision makers. But importantly, I wanted to emphasize that research actually informs this process, both on the health effects and environmental exposure aspects, but also the atmospheric sciences and engineering. In some sense, most people who work in air quality management can see where they fit into this picture, this framework that we use here. In the United States, we've got different approaches for different types of pollutants. So for the ambient standards, the criteria pollutants, we use an approach looking at what is in the volume of air. And that is the standard, is what is in terms of micrograms per cubic meter or parts per million. That's the way the standard is based. For the hazardous air pollutants, it's different. It's actually what is emitted from sources. It's called National Emission Standards for Hazardous Air Pollutants. And so that's a different approach that's used that I'll be showing you in a moment here. A third approach is market-based, and that it deals with sort of letting the market control the sources. In this instance, it's specifically targeted towards power plants that emit sulfur and nitrogen oxides. And a fourth one I'm not showing here is actually climate, which is largely done not through the Clean Air Act mechanisms, but actually through larger scale treaties and agreements. Turning first to the criteria pollutants, I put the box here to illustrate that it's actually what is in that volume of air that is of critical importance here. Again, micrograms per cubic meter, parts per million, parts per billion. And here you see the typical 6 criteria pollutants in the United States: ozone, PM, lead, sulfur, nitrogen dioxides, and then carbon monoxide. particulate matter broken into the fine particulate matter, PM2.5, which we've been hearing about all day, and PM10, which is the coarse fraction, which is actually very relevant to Mideastern dust. I might note that when I was in Egypt a few years ago, we had a cold front come through and it rained mud. There was so much dust in the air. It was really quite incredible for me. Rather than having to windshield wipers go to move snow off, which we have here, it was actually moving the mud off of the windshield. Quite interesting. So in the United States, in the most recent information that's available from 2019, you see that we have many millions of people exposed to concentrations that exceed the National Ambient Air Quality Standards. The NAAQS is what we refer to that as. One or more is 81 million people. Ozone being the most prominent. Ozone has been a continuing difficulty in the United States to deal with because of the multitude of sources in the atmospheric chemistry. PM10, PM2.5, and so forth. You see all of them there. And this, I would note, is in the Air Trends report. This is a fascinating report that shows trends over decades. And it is based upon a very extensive air quality monitoring program that we have in the United States. Over 1,000 sites that are measured these typical air pollutants. And we have actually fewer than that on the air toxic side of things. So our approach to evaluate scientific evidence is to look at it as an effort that brings to bear lots of information. We do systematic review of the literature, which often includes hundreds of thousands of studies. It's the world's literature that we're actually using. We use a standardized approach to evaluate those studies, to characterize the results and extract the data that I'll be showing you a few examples of here in a moment. And we integrate that evidence across disciplines. What's important here is that the atmospheric chemistry, for example, informs very much the exposure science work, which directly informs dosimetry and epidemiology, and then the animal toxicology research. All of this information feeds together to draw a causal conclusion. I'll show you an example of that for ozone. We develop these causal determinations not only for human health, but also for what is called welfare in the United States, which is essentially the environmental effects of these air pollutants. And we synthesize that also to look at populations of considerable concern, whether it's people with pre-existing disease, individuals that might be older or younger. We look at those populations because the strategy is if you can protect the most sensitive individuals in the population, you're then protecting the larger population at large. So we can kind of construct information here in a certain way that gives you some insights on the proportion of population affected, which is oftentimes subclinical. Individuals may not know this unless they're very active exercisers that they've got impaired lung function. They may have respiratory symptoms, including sore throats and coughing. Then at the higher level of that, where the severity is increased, some individuals will go to a physician's office, they may increase their medication and have reduced physical performance. And the top of the pyramid is, of course, considerable public health concern, which is individuals, some individuals go to the emergency room, they would be hospitalized, and then there's mortality is considerable concern around the country, as we were just hearing from the last speaker of WHO. So pulling this information together, biology underlies our understanding of what the consequences of exposure are. This shows a variety of biological pathways for the respiratory effects from short-term exposure to ozone. And then what this represents is really that consolidation of information of a variety of sorts to try to help us understand going from exposure ultimately to outcomes of concern here. And we can build a picture here of information. The solid lines are ones where in fact we've got sort of controlled experiments where you can eliminate confounders. The dotted lines are oftentimes indicating that there's not an actual controlled study that will show that in the same fashion. That's coupled with information on the exposure response relationship here from clinical following 6.6 hours of exposure to ozone. And this is a variety of studies. You'll note that most of those studies are somewhat dated now. There's not a lot of research on controlled human exposure studies in the United States. And what you see is this nice curvilinear relationship between ozone exposures and ozone forced expiratory volume in 1 second things. What I would point to is that the current standard in the United States is 70 parts per billion, which is right here. And so some individuals are showing a response of 2 to 4% reduction in FEV1, even with the exposures to that. But this is the most recent data that we've got. The third line of evidence that we use on health effects is epidemiology. And here you have a forest plot showing studies from around the world. And the vertical line is, oops, I'm sorry, the vertical dash line here, let's go backwards. There we go, is showing the evidence for respiratory effects, for asthma, for COPD and pneumonia, with those studies over here on the right side showing an increase in hospital admissions and emergency department visits with exposure to ozone. And this is all based upon a certain level of ozone exposure. So this is that coupling information together. All of this information is very relevant to the decision makers as we pull this forward. One of the steps that we do is we develop causal determinations. And this colored chart here shows you for the various health outcomes that we've got, our judgment in terms of the strength of the evidence that in fact short-term respiratory exposures result from ozone exposures. That's very clear from a causal basis. Long-term exposure and short-term metabolic effects are likely causal, and then all the rest are suggestive. The different indicators here are ones that have changed. This is a really important one here for ozone, is that unlike the previous evaluation that we did about 5 years ago, the most recent evidence essentially suggests that its short-term exposure is suggestive of an effect of cardiovascular outcomes, whereas in the last review that we did, it was actually likely. So there are some changes that do occur over time. So what is the standard that we have developed? The standard was set in 2015 that the ozone level for the National Ambient Air Quality Standards was 0.070 parts per million. And the secondary standard, which is for those welfare effects, those environmental effects, was set equal to the primary standard. And just 2 months ago, the final decision was made to retain those standards. And so that is the current standards in the United States for ozone. So in summary, for the criteria pollutants, the goal is to meet and attain and maintain levels of exposure that are consistent with the National Ambient Air Quality Standards. The standards are set to protect with an adequate margin of safety. There are numerous and diverse nationwide and mobile sources for those criteria pollutants. Cost is not considered in setting the standards. It is health and environmental based only. However, when it turns to implementing control programs, cost does come into play in terms of managers deciding should they have stricter controls on power plants versus automobiles, for example. Cost is a consideration in that. In the United States, states are responsible for the air quality management programs, and they use a toolbox to try to determine what is the best and most effective way to meet the standards. So switching gears to the second approach, which is the hazardous air pollutants, and I've shown a photograph here of an industrial facility. Often these are based on source-related concerns. It's also called air toxics, and that is that there's a source that's emitting a variety of chemicals of concern. So what are hazardous air pollutants? They're defined in the Clean Air Act as those pollutants that cause an increase in mortality or serious, irreversible, or reversible incapacitating illness. The chemicals are listed by the administrator in the Clean Air Act. They're actually listed, and standards are set to protect public health with an ample margin of safety. In the case of the criteria air pollutants, there was an adequate margin of safety, and that reflects the uncertainty is greater oftentimes with the hazardous air pollutants than it is with the criteria pollutants. In terms of the list of hazardous air pollutants, what you see is the beginning of the list. There's actually 188 chemicals on the list. It goes on and on and on. And that there was a whole political process and science process to decide what chemicals should be on the list. Again, it's somewhat under 200, but there's a lot of them of concern. If you look at those set of chemicals, there are incredible diversity of health outcomes for the different pollutants. There's both non-cancer effects as well as cancer effects. And what you see is that unlike the criteria pollutants, where there's a strong emphasis on the set I showed earlier with respiratory effects, cardiovascular effects, mortality, some of these other ones, neurological and developmental effects, for example, for lead. Here, what we have is a tremendous diversity of health outcomes. This is a study that was done of the 188 hazardous air pollutants to see which ones produce effects in humans or animals, broken out by different time frames, acute versus less than 24 hours, subchronic, which is up to 10% of a lifespan, and chronic. And what you see here is really quite a large diversity of health outcomes of concern. No surprise, respiratory shows up here, very prominent. Neurological is very prominent. Developmental, because the design of the study, shows up here for subchronic, and so forth. You can see that there's a wide diversity of health concerns for these pollutants. What is done to evaluate the pollutants is to use a risk assessment process. Even if we've had the presentations this morning, we've had information about source identification, the fate and transport, ultimately looking at concentrations in the air, but also looking at air, soil, water, and food. That's coupled with population characteristics using our census data to estimate measures of exposure, which then is coupled over here with your toxicity assessment. What is the nature of the health outcomes? What is the dose-response relationship? And ultimately, you get quantitative and qualitative expressions of risk and uncertainty. That information then feeds into a decision point under the Clean Air Act, which is, and this is looking at cancer outcomes, is there sort of a line drawn here. It's called a fuzzy bright line. And that is, if the risk is below 1 in a million for cancer, then it is really considered to be acceptable, with an acceptable or ample margin. If it is greater than 1 in 10,000, then the risk is viewed as unacceptable, and actions are taken to reduce those risks. And again, only health is considered here, not cost. If you're in the middle, which is actually where a lot of pollutants are, then risk may be acceptable. Oftentimes, again, the state organizations determine whether additional controls may be necessary to reduce the exposures and the health risks from those individuals. So it's fairly complicated. It's complicated both in terms of this process and this process to make decisions in the air toxics arena. But these health outcomes oftentimes include things like cancer, reproductive effects, neurological effects that tend to be very serious and of significant concern from a public health point of view. So in summary, the pollutants were, for the hazardous air pollutants, were listed by Congress. They are from source categories such as pulp and paper mills, such as oil and gas exploration. There's a lot of different source categories, many, more than 100 of them actually. Standards, emission standards are set, which in the phrase are limits such as how many pounds per year can be emitted or how many tons per year or during certain types of applications. What is used to determine that is called the maximum achievable control technology. People may be familiar with the term best available control technology. It's very similar, same concept. And ultimately, risks are evaluated to make sure that, in fact, the public health is being protected with an ample margin of safety. So I'd just like to end with a comment that one of the things that people always wonder about is this worth it? Is the management of air pollution worth it? And this is a study that was done, a report to Congress that was from the EPA's, or from the Office of Management and Budget, that judged that the rules with the highest estimated benefits as the highest costs across all the federal government programs arise from the Office of Air and Radiation within EPA. And those rules that have a significant aim to improve air quality account for 95% of the benefits. So air quality makes a huge difference in terms of the benefits and in some ways the costs, but especially the PM 2.5 standards. Those are incredibly important to the protection of public health in terms of this analysis. So in closing, I'd like to say that it's been a great pleasure to present with you and have the discussions this morning. I would also like to point out that in about a month, I'm actually retiring from EPA. I'm going to retain my position at Duke University where I'm an adjunct professor, but I will be retiring from EPA in just about a month. So with that, let me thank you for your attention.
John, thank you so much. I will interrupt to tell you that I was very sad to hear that you're retiring. Most of the people retired during the Trump administration because they couldn't take it, but you were brave enough to survive the administration, and then you said maybe it's too easy now, so I better get out.
Oh, there you go. Exactly. Yeah,
So,
well,
but
thank you,
you've
Patrick.
been a great friend to scientists, and you have been very supportive for science, good science to inform policy, and we really miss you. And I'm glad you accepted my invitation to come and give this talk. As always, it's very informative. I have a question that I'm struggling when I teach air pollution in my class, is when we had these 6 criteria pollutants as the beginning of the Clean Air Act. Why we did not go to 7, 8, 9, 10, 11, 12? Instead, we decided to go, like, we could have benzene, for instance, as another. And all of a sudden, we went to the hazardous air pollutants, which are regulated differently. I have some explanations, but I would like to hear your kind view about this. What really started to divert in terms of the regulations in the United States?
I can't, that's a really good and difficult question. The original set of criteria pollutants included chemicals that contributed to photochemical smog, and then ozone was identified as the indicator. So they have changed over time, and then with PM, it went from PM total suspended particulates to PM 10 and then to PM 2.5. So the chemicals have changed, but the large set has not changed from the 6 that we've got now. It's actually a political process to decide which ones should be consistent with the phrasing, numerous and diverse stationary and mobile sources. You make the point about benzene. Benzene, I think, could be consistent with that. But benzene also has a strong source orientation, so which is from automobile, from oil and gas exploration, and so forth. So it's been I think it's been a system that has worked well, and people have not felt compelled to change it. Even the list of hazardous air pollutants has not changed very much. There's been a couple of deletions and one addition to that, but it's largely held up pretty well for now 30 years, since 1990. And so I think that it's been more focused on let's deal with these issues as we move forward and not try to change that under, underlying emphasis areas. But
also, can that be, I mean, originally we thought the 6 air quality standards were about respiratory effects, and, asthmatics were the people that they were. And the other side, we had cancer, cognitive effects, reproductive, developmental. So maybe that was the distinction, but now we find that particles can cause neurodevelopment, perinatal effects, et cetera, et cetera. So there is, over the years, there is really kind of an approachment, to the similarities, the outcomes, actually.
Well, the one chemical that actually is on both the criteria pollutants and the hazardous air pollutants is lead.
Yeah.
And that was partly the reflection of the neurological concerns with lead in children, especially. But it is just a system that has been put in place, and it has held the test of time, if you will. Yeah. Thank you for the question. And by the way, I'm not going away. I'm still going to continue to teach at Duke and to be on science advisory boards. So.
Also, John is helping with my class at Harvard, so I hope to stay in touch with you. I know we're not going to lose you, but still.
I do. Thank you.
Susanna, you can take back.
Yes, thank you. So we finish our presentations, and if there's anything else, any comment from any of the panelists, I think reach our time, so we're good with time. So there's nothing else to say here. From my end, I would like to thank everyone, all the speakers, all the panelists, the members, and all the participants for today's webinar. Thank you for being here and your participation. And from my end, I'm looking forward to tomorrow's presentations and discussion. And at this point, I guess I'll hand it over to Petros and Dr. Karshik for their closing remarks and some overview about tomorrow's presentations. Thank you.
Yeah, go ahead. Eric, go ahead.
I was just saying that one of the challenges for today is figuring out the next steps in terms of identifying these parts of the world with, high PM 2.5 levels and probably other pollutants as well. And to what extent it's necessary before you reduce those levels to redo some of those studies. Is it necessary to demonstrate local effects when so much is known? I do think there are particular pollutants like dust that are particular to certain regions that can be studied more. But I think one thing to try to decide on what the next steps are and how can they be achieved. I believe Petros talked about that as well just a few minutes ago.
Mm-hmm. Yeah, and I think, as I said, I think it's an area with great challenges, and I really am upset I missed half of Mazen's talk, but I will go back and read it again. The good news is that people are starting to do studies at different states, that the ones that they can afford, but also scientists, we have introduced new tools that they can use, remote sensing and other resources to do retrospective assessments, which I think that's very important because we don't have any kind of history of monitoring in these areas. So I hope that these efforts continue and this data become available to WHO, to health scientists in the area, in the region, to study health effects. People use the standards we have developed in the United States and Europe to regulate an area with 1 billion people where the genetic makeup is different, the comorbidities are different. People who have serious problems with diabetes and cardiovascular diseases, where the climate, it's heat, it's extremely important, as you will see tomorrow. And also the composition of the aerosols are different. So I think when Mazen talks about reviewing the science, yes, the science they reviewed is mostly done in the Western countries, which does not really represent the area, and it's better than nothing. But I think it's time for the countries around that region to do the research so they can have better science to do better policy. So, and the change of the culture, and especially in the Gulf area where there is a lot of pollution and a lot of problems, I think some international cooperation. In United States, we have the states. In Europe, we have the member, the union members. But in that region, it's very fragmented, political conflicts, et cetera, which really makes it difficult to have a coordinated approach. And that's the reason I mentioned before that we will help out any way we can to provide not only the science, but also if we can help to connect different people and different groups, will be great to do. But in terms of the total morbidity and mortality, when you look the global burden of diseases, when we talk about 7 million people dying, most of the people come from that area, and of course the Southeast Asia. So the challenges are great, and with the climate change, this challenge will become greater. So so I don't want to say more. Maybe Mazen and others can add, but I will be happy to answer any questions we have that can help to continue this discussion, and also do something this after, today or after tomorrow, so we don't just talk about things.
Okay, great. I think that ends our programming for today. Unless anyone wants any other closing words, but if not, we will reconvene tomorrow on the same Zoom link at 8 a.m. Thank you.
Bye.
Goodbye.
Thank you.
Bye.